5 gradi ti ho fatto.
But the death toll is certainly much higher. Last year, the equivalent of 255 million full-time jobs were lost globally, around 4 times those lost during the financial crisis. At least 1.5 billion students were out of school in March last year. Close to 700 million students are still not receiving an education in person today. The global crisis is not over. We must act fast, or else these human, economic, and social costs risk climbing further significantly. In Europe, we have responded in a forceful and coordinated way. Our doctors and nurses have assisted thousands of patients, often in overcrowded hospitals. My gratitude goes to them for their selfless service, which has cost many of them their lives. Our governments and central banks have launched successive rounds of fiscal and monetary stimulus, which have certainly helped to save jobs and prevent unnecessary bankruptcies. Our scientists have developed a number of effective vaccines at an unprecedented speed. We are rolling them out fast, starting with the elderly and the most fragile, and guaranteeing them freely to everyone. After a year and a half, we are starting to see the end of this tragedy. For the first time, normality is looking near. Unfortunately, in many other areas of the world, the pandemic shows no sign of abating. The differences in the vaccination rates are staggering. Close to 1.5 billion doses of vaccines have been administered in over 180 countries worldwide. Only 0.3% of them are in low-income countries, while richer countries have administered around 85% of them. Not only are these disparities unacceptable, they are also a threat. So long as the virus continues to circulate freely around the world, it can mutate dangerously and undermine even the most successful vaccination campaign. We must make sure the vaccines are more available to poorer countries. It is essential that we allow the free flow of raw materials and vaccines across borders. The EU has exported about 200 million doses of COVID-19 vaccines to 90 countries, roughly half of its total production. All states must do the same. We must lift blanket export bans, especially to poor countries. Regrettably, many countries cannot afford to pay for these vaccines. That's why initiatives such as ACT Accelerator are so important. So far, Italy has given 85 million euros to COVAX and a further 30 million to related multilateral projects. Now, Italy is pledging today 300 million more for poor countries for vaccines and 200 more for climate and health in poor countries. I'm very glad to announce today that this week we plan, as I said, to increase significantly the contribution. We must also help low-income countries, including in Africa, to manufacture their own vaccines. We will likely need multiple rounds of vaccination in the future, and boosting production is essential. One suggestion is to introduce a patent waiver on COVID-19 vaccines. Italy is open to this idea so that's targeted, so as far as it is targeted, time limited, and does not undermine the incentive of pharmaceutical companies to innovate. I understand that Ursula has another idea which is also innovative and very innovative and perhaps in perspective more realistic. But this proposal doesn't guarantee that low-income countries are actually in the position to manufacture their own vaccines. We must support them financially and especially with specialized know-how. Italy welcomes the initiative from the European Commission aimed at manufacturing vaccines and health products in low and middle-income countries. We want to engage our pharmaceutical companies and our research centers to help production, particularly in Africa. And we will do so alongside other partner countries, including France and Germany. Again, we have today a pledge that goes to 50 million doses by year-end, before the year-end, for low-income countries, so we can join other partners in vaccines donation. But our plan for low-income countries must move beyond the immediate health response. On top of the staggering losses of human lives, the present crisis has taken a heavy toll on economic opportunities, education systems, and social infrastructure. The risk is that vaccine inequality will lead to greater income inequality. I think it's led already to greater income inequality. Italy has endorsed a 4-point strategy to help the world's most fragile countries, allocating special drawing rights to support the balance of payments of countries in need, replenishing early the IDA, the International Development Association, encouraging multilateral development banks to enhance their net financing activities, and suspending temporarily debt service payments to shield countries in need. Italy has been one of the countries hit first and hardest by the pandemic. We have learned our lessons, and we want to put them to good use. As presidency of the G20, we want to lead the global push to design better global responses to the current and the future health crisis. I very much welcome our debate today, and I look forward to hearing you all. Thank you.
Thank you very much, Mario. Good morning, good afternoon, and good evening to all of you. Excellencies, dear friends, honorable leaders of the G20, distinguished guests and esteemed representatives. We have many international and multilateral organizations here. You are here with us today. Welcome to the Global Health Summit. It is an honor and it is a privilege to chair this meeting with my dear friend, Prime Minister Mario Draghi. Well, indeed, 1 year ago, Italy was the epicenter of the pandemic. We saw the virus raging, we saw the despair on the faces of doctors and nurses, but also acts of enormous solidarity within communities and between communities. The world was caught off guard by COVID-19. So today, 1 year later, we are gathering to open a new chapter in the history of global public health. The Rome Declaration must send a clear message to everyone throughout the world. We must unite both to end this pandemic and to prevent and prepare for future health emergencies. And therefore, this is the very first time that we come together specifically on health. And we must make sure together that this is the last global pandemic. This must be the goal of the Rome Declaration, that we are better prepared and that we uphold the principles of equity and good governance by giving our health and care workers the ability and the resources they need to take care of us, by making sure that we do not succumb to health nationalism, that we keep supply chains open, and that we use all available tools to support access to vaccines, diagnostics, therapeutics, and other medical supplies. By building our preparedness and response on science and evidence, we will move forward. By continuing to pay attention to global health after the crisis has passed, this is difficult, and by establishing sustainable finance mechanisms to really support it. But first, we must act now to bring the pandemic under control all over the world, not just in some countries or regions, but everywhere. We now have safe and effective vaccines. And this was possible thanks to the investment that we have made in this and the last year, both individually through advanced purchase investments and through the new multilateral initiatives we created, the ACT Accelerator and COVAX. But the gap between high and low-income countries remains too wide. So here's our first goal today. Let us give a boost to the vaccination campaign in low and middle-income countries with practical and measurable actions. First, we must allow for the export of vaccine doses to the rest of the world and maintain open supply chains. As Mario said, 50% of the European production has been exported to 90 countries, COVAX included. And Europe commits to continue doing that in the spirit of equity and solidarity, but also in the spirit of safety for all of us. Second, I am delighted to inform you that in the pre-summit, our industrial partners in Europe committed themselves. 1.3 billion doses of vaccine will be delivered until the end of this year to low-income countries at no profit and to middle-income countries at lower prices. And on top of this, our industrial partners committed to over 1.3 billion doses more for 2022, many of which will be delivered through COVAX. So thank you very much for that. And third, preventing future health emergency means strengthening capacities throughout the world. Today, Africa imports 99% of its vaccines, and this has to change. And therefore, Team Europe is launching an initiative with African partners to develop vaccine production in Africa. The initiative will develop a number of regional hubs distributed across the continent, and it will draw on the full toolbox of Team Europe, including 1 billion of investment. Now the Global Health Summit is at a starting point. Indeed, we will certainly also discuss the topic of TRIPS and intellectual property, as Mario mentioned. Well, we all know voluntary licensing is the best way to ensure the necessary transfer of technology and know-how together with IP rights. But the existing TRIPS agreement and the 2001 Doha Declaration already today foresee compulsory licensing as a perfectly legitimate tool for governments to use it in a crisis. And this will be reaffirmed today. But I've been also listening very carefully to developing countries. We had just the summit in France a few days ago, who are complaining about how difficult it is to use these flexibilities. And I think this is something where the global community has to act to provide security and predictability. The European Union will therefore come forward with a proposal in WTO in early June to offer a third way in support of the Director General of the WTO, Ngozi. Now, the beginning of a common path for the G20 is today, and the Rome Declaration is the first important milestone of this journey. Thank you very much for being with us, and Mario, the floor is now to you again.
Thank you. Thank you very much. Thank you, Ursula. The first speaker today is the Secretary General of the United Nations, António Guterres. Dear António, the UN can play a key role in fighting pandemics and has certainly done great things. Tell us more about how we could increase our chances to end the COVID-19 pandemic and prevent more dangerous variants from gaining a foothold. Please, floor is yours, António.
Thank you very much, Mario. Excellencies, dear friends, good morning, good afternoon, and good evening. From the start of the COVID-19 pandemic, I warned that no one is safe until everyone is safe. And I was deeply concerned by the possibility of a dangerous two-speed response. Sadly, that concern was justified. Grossly unequal access to vaccines, tests, medicines, and supplies, including oxygen, have left poor countries at the mercy of the virus. Recent surges of COVID-19 in India, South America, and other regions have left people literally gasping for breath before our eyes. And the pandemic is still very much with us, thriving and mutating. As winter approaches in the global south, I fear the worst is yet to come. Dear friends, vaccinating quickly and thoroughly around the world, together with continued public health measures, are the only way to end the pandemic and prevent more dangerous variants from gaining a foothold. But so far, more than 82% of the world's vaccine doses have gone to affluent countries, and just 0.3% have gone to low-income countries. The G20's Rome Declaration is a significant step to provide equal access to vaccines, but we need a follow-up mechanism backed by the political will to translate the declaration into a global vaccination plan. We have many initiatives, but we must make sure that they add instead of subtracting. We must make sure that there is a coordination of those different initiatives. Some of them were just announced today. And so I repeat my call for the G20 to set up a task force that brings together all countries with vaccine production capacities, the World Health Organization and the ACT Accelerator partners, the international financial institutions, able to deal with the pharmaceutical companies and other key stakeholders. task force should address equitable global distribution by using the COVAX facility. And it should aim to at least double manufacturing capacity by exploring all options, from voluntary licenses and technology transfers to patent pooling and flexibility on intellectual property rights. The G20 task force should be co-convened at the highest levels by the major powers who hold most of the global supply and production capacity, together with the multilateral system. I'm ready to mobilize the entire United Nations system to support these efforts. The task force must also leverage the ACT Accelerator and its COVAX facility. Let's be clear. We are at war with the virus. And if you are at war with the virus, we need to deal with our weapons with the rules of a war economy. And we are not yet there. And this is true for vaccines, and is true for other important components of the fight against the virus. By now, COVAX should have delivered 170 million doses around the world. But due to vaccine nationalism, limited production capacity, and lack of funding, that figure is just 65 million. I call on G20 countries to lead by example and contribute their full share of funding. An investment of billions could end up saving trillions and saving lives. Dear friends, a global coordinated effort on vaccines can end this pandemic, but it will not help prevent the next. And I fully support last week's bold recommendations from the Independent Panel for Pandemic Preparedness and Response. The world needs political commitments at the highest level to take internationally coordinated, cross-cutting measures and transform global pandemic preparedness. The bedrock of the recovery from COVID-19 and of preventing and addressing future health crises is universal health coverage and robust primary healthcare systems. These are essential to achieving SDG 3 and the entire 2030 Agenda for Sustainable Development. Dear friends, it is time for decisive action. I urge G20 countries in collaboration with the United Nations to assume a strong leadership role in ending this devastating global pandemic. Together, we can and we must build a healthier, safer, fairer, and more sustainable world, and I thank you.
Thank you very much, Secretary General, dear António. Indeed, the United Nations and its agencies have played a crucial role in the management of the pandemic, also thanks to your leadership. So thank you very much for that, and let me now turn to President FERNANDEZ of Argentina. Dear President, dear Ángel, the floor is yours.
Good morning from Buenos Aires, Argentina. Madam President of the European Commission, Ursula von der Leyen, Mr. President of the Council of Ministers of the Italian Republic, Mario Draghi, Excellencies, I wish to thank the government of Italy, which is holding the G20 presidency, and the European Commission for convening this meeting. I particularly acknowledge the participation of the scientific community through the panel of experts, and of the representatives of civil society, mindful of the contributions to the preparatory process for this meeting. It is most appropriate to take stock of the response to the pandemic and to focus on how to enhance our cooperation to overcome this scourge. All of us together should find the health, social, economic, and environmental solutions to enable better recovery in all countries. Over a year after the first outbreaks, we are suffering serious health, economic, and social consequences, with a disproportionate negative impact on developing countries and on our most vulnerable populations. The COVID-19 virus spread at an unprecedented speed, laying bare the weaknesses of the global system of preparedness and response to public health emergencies. Likewise, this exposed vulnerabilities and inadequacies in our social, political, economic, and health systems, as well as in the international financial system. My own region, Latin America, now faces one of the most critical times in the pandemic due to the onslaught of a new outbreak that severely afflicts our countries. The serious inequality in access to medicines and vaccines represents an especially unfair and immoral situation that is contrary to the interests of the international community as a whole. It is essential to guarantee equitable and solidary access. This should be a priority for all states, since it is a necessary condition to overcome this pandemic and to promote the effective enjoyment of the right to health. The unprecedented scientific achievements made should benefit all. This is why we must redouble our efforts to ensure equitable access to tools against COVID-19. We must identify proper means to ensure the transfer of technology as well as the licensing of intellectual property rights to enable us to increase global vaccine production. Furthermore, we should review and upgrade the global health architecture so as to be able to share knowledge, carry out joint research, and foster the participation of developing countries in international scientific networks. Redesigning the global health governance system is the starting point. This is why we support the adoption of new tools and strategies aimed at favoring preparedness and response to emergencies on the basis of solidarity and cooperation internationally. We need a stronger global health governance system and one that is properly financed. Madam Co-Chair, Mr. Co-Chair, the tough reality shows us that no one can save themselves alone. This motto embodies a profound teaching that we must translate into concrete facts. In this regard, the pandemic is a wake-up call and at the same time, an opportunity for us to move towards more equitable, more inclusive, and fairer societies. It is also an opportunity to redesign health systems that are more solidarity-based and guarantee an effective enjoyment of the right to health with equity and quality in all countries. I trust that the adoption of this Declaration of Rome will give a new boost to accelerate joint efforts to ensure greater access to supplies to fight COVID-19 for the benefit of everyone on this planet, without leaving anyone out. Thank you very much.
Thank you, President. The pandemic had indeed a very negative impact on developing countries. It's important to address the issue of global distribution of vaccines. And for this, I'm now turning to Prime Minister Trudeau of Canada. Dear Justin, the floor is yours.
Bonjour à tous. Thank you first to dear Mario and Ursula for your leadership and for bringing us together today. It is so good to see so many other friends gathered here as well from around the world. Because for people around the globe, it's been an incredibly difficult year. But even if we still have a lot of work to do to fight this pandemic, there is reason for hope. Just take the unprecedented scientific achievements we've seen in the last year, or the remarkable international cooperation. This pandemic has been a powerful reminder of just how interconnected we all are. Collaboration is the only way to overcome the challenges people face in every part of the world. That's why it's vital that we continue to come together, including through multilateral institutions like the G20, on strengthening respect for international law, reaffirming our collective commitment to human rights, and standing up for people who face persecution and suffering abroad. Our collective success depends on finding a better path to shared peace and prosperity for everyone. Many countries are still facing devastating waves of this pandemic. Canada has always been and remains a strong advocate for equitable access to vaccines and treatments around the world. We must do everything we can to make sure that everyone, including the most vulnerable, has access to safe, effective doses. We will continue to work actively with our partners, including at the WTO, to identify and reduce barriers to vaccine access. Initiatives like the ACT Accelerator and COVAX are also key to making sure no one is left behind. That's why Canada has contributed $1.3 billion to the ACT Accelerator. Canada's pleased to be among the top donors and is one of the few to have already met our proposed burden share. Since February 2020, We've mobilized more than $2.5 billion in international assistance in response to the pandemic. We've also provided funding for humanitarian assistance and sent essential supplies to India as they battle a devastating wave of this virus. On doit poursuivre cette lutte ensemble. Et le Canada va continuer d'être là avec du soutien à l'international jusqu'à ce que tout le monde ait réussi à traverser cette crise. COVID-19 has laid bare gaps that exist in the way we tackle health emergencies as a world. We must keep improving our global health public emergency architecture for now and for future generations. Based on the recommendations of the IPPPR and other reviews, Canada is committed to working with all WHO member states to strengthen our health systems. We need to learn from this pandemic. This means working toward greater coordination at all levels, investing in preparedness and strengthening surveillance and warning systems. And it also means ensuring that we have the arrangements and funding in place to rapidly scale up public health responses when needed. Canada welcomes the Rome Declaration. Its principles and commitments will help ensure that together we do more to prevent and prepare for future crises and have greater collective resilience. Job one remains fighting this pandemic, but it's also time to look to what comes next. This is the moment to ask ourselves, what does building back better mean in the context of global health? We've been focusing a lot on one disease, but we know that others have not gone away. In the past decades, we've made remarkable gains in life expectancy and against other infectious diseases like HIV and polio. We must not lose this hard-won progress. In fact, we must push to do even better. Our citizens need us to go further on support for mental health, on defending a healthy environment, on ending gender-based violence, and on standing up for sexual and reproductive health rights for women and girls. We have a lot of work ahead, and that's why we're all here today. Ensemble, on va bâtir un avenir plus sain et plus durable pour tous. Merci, mes amis. Thank you so much.
Thank you so much, Justin, for your strong words, and thank you so much for your exemplary support, indeed, of Act A and COVAX. You are one of the top funder of Act A, and many, many thanks for that. Now, let me turn to President Xi Jinping of China. Dear President Xi, the floor is yours.
各位同事，
Dear
一年
colleagues,
多来，
Liebe Kolleginnen,
the past year
liebe
and more
Kollegen,
have seen
im
repeated
vergangenen Jahr
resurgence
病毒
and
haben wir immer
frequent
wieder
mutations of the
erlebt,
coronavirus.
dass das Coronavirus wieder
The most serious
aufgelebt
pandemic
ist und
in
dass
the
wir neue
century
Varianten
is still wreaking havoc.
gesehen haben. Auch das hinterlässt Spuren
早日
überall auf der
战
To
胜
Welt.
clinch an early victory against
Einen
COVID-19
frühen Sieg gegen
and restore
Covid-19
economic growth
einzufahren und die Wiederherstellung
remains
des
the top
wirtschaftlichen
priority for the
Wachstums
international
bleibt
community.
deshalb die
Here,
oberste
I want to
Priorität
make
für die
5 points on
Völkergemeinschaft.
what we need to do.
Ich möchte gerne die folgenden 5 Punkte ansprechen.
First, we must put people and their lives
Zunächst
first.
müssen wir die Menschen
To
und
completely
ihr
defeat
Überleben in
the
den Mittelpunkt
virus,
unseres Handelns
we
stellen,
must
wenn es darum
demonstrate
geht,
a
das
great
Virus zu
sense of
bekämpfen.
political
Dazu
responsibility
müssen wir
and
unsere
courage,
politische Verantwortung gerecht
make
werden und den
extraordinary
notwendigen Mut
responses
an den Tag
to an
legen.
extraordinary challenge,
Außergewöhnliche Reaktionen
and
und
truly
Antworten finden
respect
für
the value
außergewöhnliche
and
Herausforderungen.
dignity of
Gleichzeitig
every
die
human life.
Integrität und die Werte des menschlichen
Meanwhile,
Lebens
it is
schützen.
also important to
Es ist
minimize
aber
the
auch
potential
wichtig, dass
impact on
wir
people's
die
lives
potenziellen
and
Auswirkungen auf das
maintain
Leben
general
eines
order
jeden
in our
Einzelnen
society.
zu reduzieren und die Ordnung der Gesellschaft
Second,
zu wahren.
we must follow science-based policies
Wir
and
müssen
ensure a
unsere
coordinated and
politischen
systemic
Maßnahmen auf
response.
wissenschaftlicher Grundlage
We should coordinate pharmacological
各位同事，一
Dear
年多
colleagues,
来，疫情
the past
起
year
伏
and more have seen repeated resurgence
病
and
毒
frequent mutations of the coronavirus.
100年来
The
最
most
严重
serious
的
pandemic
传
in
染
a
病大
century
流行
is
仍
still
在肆
wreaking
虐。
havoc.
早日战
To
胜疫
clinch
情
an early
恢复
victory
经济
against
增长
COVID-19
是
and
国际社
restore
会的首
economic
要任务
growth remains the top
我谈
priority
5 点
for the international community. Here, I want to make 5 points
第一
on what we
坚
need to
持
do.
人民至上，生命
First,
至上，
we must put people and their lives
要
first.
彻底战胜疫情。
To completely
必须
defeat
极
the
大
virus,
的政治
we
担
must
当和
demonstrate
勇
a
气
great sense of political
非常之
responsibility and
应对
courage,
非常之事，
make extraordinary
切实
responses
尊重
to
每
an
个人的生
extraordinary
命价值
challenge,
和尊严。
and truly respect the value and dignity of every human life. Meanwhile, it is also important to minimize the potential impact on people's life and maintain general order in our society. Second, we must follow science-based policies and ensure a coordinated and systemic response. We should coordinate pharmacological and non-pharmacological interventions, balance targeted routine COVID-19 protocols and emergency measures, and ensure both epidemic control and socio-economic development. G20 members need to adopt responsible macroeconomic policies, keep the global industrial and supply chains safe and smooth, and give continued support to developing countries. Third, we must stick together and promote solidarity and cooperation. We, humanity, rise and fall together with a shared future. We must tide over this trying time together and firmly reject any attempt to politicize, label, or stigmatize the virus. Political manipulation would not serve COVID-19 response on the domestic front. It will only disrupt international cooperation against the virus and bring greater harm to people around the world. Fourth, we must uphold fairness and equity as we strive to close the immunization gap. Today, the problem of uneven vaccination has become more acute. It is imperative for us to reject vaccine nationalism and make vaccines more accessible and affordable in developing countries. Major countries need to take up the responsibility to provide more vaccines to developing countries in urgent need. Fifth, we must address both the symptoms and root causes as we improve the governance system. It is important that we enhance our capacity of monitoring, early warning, and emergency response, our capacity of treatment of major pandemics, of contingency reserve and logistics, of fighting disinformation, and of providing support to developing countries. It is important that we strengthen and leverage the role of the UN and the WHO, and uphold the spirit of extensive consultation, joint contribution, and shared benefits in COVID-19 response. In continued support for global solidarity against COVID-19, I wish to announce the following. China will provide an additional $3 billion in international aid over the next 3 years to support COVID-19 response and economic and social recovery in other developing countries. Having already supplied 300 million doses of vaccines to the world, China will provide still more vaccines to the best of its ability. China supports its vaccine companies in transferring technologies to other developing countries and carrying out joint production with them. Having announced support for waiving intellectual property rights on COVID-19 vaccines, China also supports the WTO and other international institutions in making an early decision on this matter. China proposes setting up an international forum on vaccine cooperation for vaccine developing and producing countries, companies, and other stakeholders to explore ways of promoting fair and equitable distribution of vaccines around the world. Let us join hands and stand together to build a global community of health for all, and work for a healthier and brighter future for humanity. Thank you.
Thank you, President Xi Jinping, for your words, your pledges, your commitments. Thank you for your action. Let me now give the floor to President of the European Parliament, David Sassoli. Dear David, the floor is
Thank Thank you, dear President Draghi, dear President von der Leyen, ladies and gentlemen, representatives of governments, international organizations. Thank you very much for inviting the European Parliament to this summit, which comes at the most dramatic time in contemporary history. A year and a half since the outbreak of the pandemic, which struck Italy first in the winter of last year, we have covered a great deal of ground, and we can now come to a common plan of international action to prevent and cover ourselves from future pandemics. We've learned so much from this pandemic. Firstly, that no one is saved alone. Only together can we defeat the pandemic at a global level. And not only that, it tells us that this pandemic affected, out of all proportion, the most vulnerable segments of the population: young people, women, ethnic minorities, people with disabilities, senior citizens, the elderly. In health is a common good to be protected so that the weakest are not abandoned. We know that nothing will ever be as it was before. The old normality cannot become new normality, but we hold the keys. Yes, we do. To build a different future, which is more sustainable, equitable, inclusive. As you know, the European Union has deployed a response to counter the health crisis, though it has limited competence in the field of health. A sector which sees national states that remain mainly responsible, but the pandemic has helped us understand how appropriate and convenient a common action is to protect the health of our citizens. Europe obviously needs broader coordination in European competencies. This is what our citizens ask of us. This is what the situation points to. But the European Union has maintained and kept so many of its promises. It is laying down the foundations for a Europe of health, where the 27 member states can concentrate in an effort to improve preparedness and resilience of European health system when faced with risks such as COVID-19 and future crises. In particular, we are trying to strengthen the preparedness role, the role of responding to crisis with some key agencies of the European Union, namely the European Health Emergency and Preparedness Agency, HERA, and the European Medicines Agency. We are also preparing to provide a response to health crisis. The HERA agency will be launched next autumn, and as from now, the European Union is taking steps to deal with the variants of COVID-19. And they are of very serious concern to us, improving their detection and their evaluation and assessment. We need to invest more into research to step up production. The action undertaken by the European Union, dear ladies and gentlemen, are having a positive impact on vaccination campaigns, which are accelerating, especially in these last few weeks, attaining major goals in many countries of the Union. We see a gradual reopening of schools, universities, workplaces, businesses, trade, cultural facilities, with its opening to multilateralism. Since the start of the pandemic, the Union has decided to export the vaccine supporting the COVAX platform with 2.2 billion euros, providing the 68 million doses to medium and low-income countries. We are extremely proud of this, that we have exported 40% of our production, believing that making low and middle income countries safe is not only our duty, but it is the sole chance to guarantee our recovery. And not only that, European Union member states have decided to share over 11 million surplus vaccines with developing countries. The European Parliament has already given its support to the ACT accelerator and the COVAX instrument, and will continue doing so. Within this framework, I believe that it is very important that President Biden decided to donate 20 million doses to most severely affected countries on top of the 60 million already promised and pledged. I believe that this is a major step forward. It's a concrete step. If all member states of the G20 were to decide, they too, to share a reasonable amount of vaccines with countries in difficulty, to do away with restrictions to exports, and in particular, if they were to do so for those doses for the COVAX instrument, it would be a very concrete step. And I would like to support this proposal that a G20 task force be established to coordinate efforts for production and vaccination campaigns. It is a matter of responsibility, but also of convenience, because no one can be safe unless we are all safe. And to do so, we need to support the production capacity of vaccines in medium and low-income countries. And this can be done. We can do this. And we can achieve this by means of agreements and licenses on the sharing of know-how and knowledge, on keeping prices low. We need to explore coordinated solutions at a multilateral level that provide for not only a voluntary sharing of licenses for production, but also compulsory forms of sharing of licenses within the framework of an emergency, in the event of an emergency such as this. We believe that there are measures of flexibility within the TRIPS agreements, within the WTO, that we need to explore together and in a coordinated fashion. This is why I believe that it is important that the European Commission has made a proposal for a common action on the part of the European Union within the WTO. It is our duty to explore all available solutions, and there can be no taboos in this. Within this framework, the European Parliament yesterday affirmed in a resolution voted in our plenary that we need to assess proposal for a targeted and limited suspension of intellectual property rights, such as the ones presented by India and South Africa at the WTO. The European Union can have no bias in a constructive debate to assess its potential and concrete impact. In thanking President Draghi and the Italian government and the Commission for calling us to accept our responsibilities, I'd like to stress once again that we cannot overcome this pandemic unless we make a common effort for the common good. I hope that we shall find the necessary courage and wisdom to undertake the ambitious challenges that this situation without precedents poses to us.
Thank you very much, President Sassoli, dear David, and thank you for the ongoing constructive support of the European Parliament throughout this crisis. Now, let me turn to President Macron of France. Cher Emmanuel, you just had a few days ago, you chaired a very successful summit on financing the Global South and the special drawing rights. So we're interested to hear of that and others. The floor is yours.
Madame la Présidente, chère Ursula, Monsieur le Premier ministre, cher Mario, Mesdames et Messieurs les chefs d'État et de gouvernement, Mesdames et Messieurs, nous avons fait naître Acte A dès avril 2020 pour faire des moyens de lutte contre la pandémie des biens publics mondiaux. Cette initiative inédite a apporté des réponses essentielles, mais l'urgence sanitaire internationale demeure. Nous n'avons pas encore réussi le pari de l'accès global, notamment aux vaccins. Alors aujourd'hui, nous devons investir deux voies. La première, agir sur la production en levant toutes les barrières. La deuxième, agir sur la distribution avec un objectif, donner à tous accès le plus vite possible aux vaccins, aux traitements, aux tests. Sur la première voie, la production. Il nous faut augmenter les capacités et mieux les répartir. C'est pourquoi je souhaite que le mandat d'ACTA soit aujourd'hui étendu aux enjeux de production des vaccins, des traitements et des tests. Il s'agit d'accélérer les partenariats de production, les transferts de technologies et de savoir-faire sur tous les continents. Pour cela, il faut associer toutes les parties prenantes. Gavi, CEPI auront besoin de l'expertise de l'OMS, des moyens de la Banque mondiale et surtout du savoir-faire en matière de transfert de technologie du Medicine Patent Pool d'Unitaid. Je souhaite ici à nouveau faire appel solennellement au secteur privé. Vous avez été au rendez-vous de la recherche. Nous avons été, État, au rendez-vous des financements, avec des mécanismes de précommande innovants qui ont permis de disposer de vaccins aussi rapidement. Maintenant, nous devons collectivement être au rendez-vous de la production, de l'accélération de la production et de l'investissement pour l'avenir sur tous les continents. C'est aussi votre devoir. Également, je souhaite que l'Organisation mondiale du commerce puisse contribuer à ces travaux pour identifier de manière précise, objective, les obstacles à l'accès global, que ce soit les restrictions aux exportations de certains intrants, ingrédients, ou encore les questions de propriété intellectuelle, sur lesquelles, je veux le dire ici très clairement, il ne doit y avoir aucun tabou, aucune idéologie, simplement des solutions reposant sur un diagnostic clair. À chaque fois que la propriété intellectuelle est un obstacle à la production, nous devons y apporter une réponse, comme nous avons su le faire jadis sur la production des trithérapies face au VIH. C'est pourquoi je demande à ce que les travaux d'ACTA sur les productions des outils Covid puissent faire l'objet d'un rapport conjoint, incluant les analyses de l'OMC, de l'OMS, devant le G20, que tu recevras à Rome en octobre prochain, cher Mario. Si ces conclusions impliquent de faire usage de nouvelles mesures en matière de propriété intellectuelle, évidemment, je les soutiendrai. Ensuite, la deuxième voie, pour laquelle, vous le savez, je suis engagé depuis le début de cette crise, celle du partage des doses. Les pays riches ont précommandé de grands volumes de vaccins, qui nous parviennent désormais dans de larges quantités. Pendant ce temps, COVAX attend désespérément des doses pour livrer les pays les plus fragiles. Cet appel est aussi déchirant qu'inadmissible. Et il nous interdit de faire de la politique avec nos doses. Je veux être ici clair avec vous. Non au clientélisme, oui au multilatéralisme vaccinal. Un principe sur lequel nous devrions tous nous accorder, aucune dose ne doit rester inutilisée. Nous n'avons pas le droit de stocker les vaccins dans certains pays, alors que d'autres en manquent. Et il est choquant, vous en conviendrez, qu'on commence parfois à vacciner les enfants, là où on n'a pas encore commencé à vacciner les plus âgés et les plus fragiles dans d'autres pays. La France a à cet égard été la première à partager ses vaccins à travers le mécanisme COVAX, vaccins qui sont, à l'heure où je vous parle, utilisés pour vacciner les personnels prioritaires en Afrique. C'est une initiative que j'ai voulu européenne et dans ce cadre, je veux ici vous le dire très solennellement, la France partagera au moins 30 millions de doses de différents vaccins d'ici la fin de l'année. D'autres pays ont indiqué vouloir suivre la même voie et je salue ici le ralliement des États-Unis annoncé plus tôt cette semaine. Je m'en félicite car il est urgent de monter en puissance, de faire plus, plus vite et maintenant, pas dans 3 mois, pas dans 6 mois. Nous devons aussi tirer des leçons de notre mobilisation collective. Tant que la lutte contre la pandémie perdure, nous aurons besoin d'ACTA. Mais nous devons identifier et corriger ces faiblesses. C'est pourquoi je propose que soit conduite une revue stratégique pour en optimiser le fonctionnement et la gouvernance. ACTA doit devenir une plateforme réellement inclusive, transparente et exemplaire. Ensuite, nous savons que le vaccin seul ne suffira pas pour remporter ce combat. Nous devons soutenir davantage l'ensemble des piliers de l'initiative ACTA. La France s'engage ici à apporter 500 millions d'euros supplémentaires à notre arsenal de lutte contre le Covid pour nous permettre d'aller plus loin, plus vite, sur les priorités que nous avons identifiées. D'abord, accélérer la production des vaccins, des tests et des traitements. Ensuite, permettre à tous d'accéder à la vaccination, y compris les populations les plus vulnérables. Enfin, soutenir les systèmes de santé nationaux, clés de voûte de notre plan de bataille. Ces moyens seront mis à la disposition d'ACTA cette année et l'année prochaine, en fonction des résultats de l'audit et de l'extension de son mandat. Pour l'avenir, nous devons tous ensemble repenser notre système de lutte contre les pandémies. Et pour cela, je vous donne rendez-vous à l'Assemblée mondiale de la santé la semaine prochaine. Merci à toutes et tous, bon courage et bonne réunion. À très bientôt.
Thank you, Emmanuel. I agree with you that there are two priorities for solving the crisis now and making global access a reality. Boosting production of COVID-19 tools on all continents and sharing more equitably the vaccines produced. So for this reason, I completely share your support to Act A until the end of the pandemic by comforting financially all its pillars, including the new priority on production, and by making it more transparent and more inclusive. Let me now turn to Chancellor Merkel of Germany. Dear Angela, the floor is yours.
Dear Mario, dear Ursula, dear colleagues, I'm delighted to have the opportunity to be with you today, and I would like to strongly welcome the initiative taken by Italy to host this health summit today. I believe it comes at the right point in time. Despite the immense progress we have made with regard to research into production and distribution of vaccines, it is fair to say that this pandemic's grip on the world is still tight. We are facing a host of new virus variants, which we have to address and tackle. Thus, today's debate is ever so important. We've all learned the lesson that the pandemic will only be over once everyone has access to vaccines. So this makes it another priority issue during our discussion to date. As early as in 2017, when Germany had the presidency of the G20, we started focusing on health and pandemic preparedness and placed it on the G20's agenda. We set up a global plan of action and carried out a pandemic exercise. And nevertheless, we had to state that last year, when the pandemic held us in its grip, we were not appropriately or sufficiently prepared. And this is why Germany, and I personally support the Declaration of Rome, which outlines the important aspects of future work. And I would also like to mention the World Health Assembly, which is about to meet in a couple of days, and encourage everyone to draw the right lessons from the experiences we have made so as to ensure that we are better prepared in future. This presupposes that multilateral cooperation takes place in a transparent manner, that WHO is appropriately and adequately funded. I very strongly support the proposal made for a global treaty on pandemics, as submitted by the President of the European Council. I think it could constitute an international commitment of each and everyone to focus on the subject matter, even once this pandemic has been overcome. What is important now, however, are the most urgent tasks that need to be addressed. Allow me to highlight that under the presidency of Saudi Arabia, the G20 started to be active here. Act A and COVAX were the right structures that were created under Saudi Arabia's presidency of the G20 within the WHO. Today, it's fair to say that we have to monitor and take a look at the instruments at our disposal, diagnostics, therapeutics, vaccines. This is what we need to focus on. I very strongly support the commitments made already. I think we should continue to act and use the leeway that the TRIPS and the Doha Agreement give us. There are many ways in which we can be active, and I believe we ought to continue to do so on this basis. As far as Germany is concerned, we have already made available 2.2 billion euros for ACTA's work, more than 1 billion for COVAX, the vaccination pillar of ACTA. We've already made available 70 billion doses of vaccines in the framework of COVAX to more than 122 countries, but we are quite aware of the fact that this is anything but sufficient. And this is why I too would like to follow suit, following the French example, and say that we will make available by the end of the year another 30 billion doses of vaccines. For the money invested in COVAX is not sufficient guarantee that this will actually be translated into doses of vaccines being distributed right now. It's very important that we increase the production and manufacturing of vaccines everywhere on all continents, and I say that especially with an eye to Africa. This is why I welcome the fact that COVAX has set up a working group that focuses on the manufacturing of vaccines. The European Union will cooperate closely with this working group. I call upon all companies, governments, international organizations to do their bit and participate here in order to ensure that the global production of vaccines can be improved and that we focus on this in the years to come, because what we have to expect is that this pandemic is going to be with us for quite some time to come. Building and expanding production capacities in a number of countries is already underway. Africa ought to be our focus here now, and I want to be very clear in that regard. Only 1% of vaccines required is being produced on the African continent right now. This is something that needs to be expanded beyond the present pandemic of COVID-19. As Europeans, and I take pride in that, as a country that is a member of the European Union, we have already made available 40% of the vaccines produced in Europe and exported these 40%. We have assisted countries all over the world with vaccines produced in Europe, and I think that that is the right approach. As Team Europe, as Ursula von der Leyen, the President of the EU Commission, calls it, will continue to do its part in the framework of the existing structures. So, in a nutshell, I believe that the G20, and I'd like to thank you, dear Mario, in that regard, given the very tight and tense situation right now, the G20 makes an important contribution, and I think it's what is to be expected of us, because the G20 are the leading economies of the world. So if we don't do it, who is supposed to do it in the face of such a pandemic? And this is why I believe that the Declaration of Rome is a milestone on the path towards combating this pandemic. Thank you, and my best regards go to Rome.
Thank you so much, Chancellor, dear Angela. Thank you very much for donating another 30 million doses of vaccine till the end of this year, and thus joining the donation of France and Italy we have already today in doses. And thank you very much for being such a strong supporter indeed to Team Europe's initiative to build with the African partners together manufacturing capacities in Africa. So thank you very much for that. And with that, I turn to the President of the European Council, Charles Michel. You have the floor.
Okay. Charles? Charles, we cannot hear you. Anyway, now, while they fix the equipment here or there, let me go ahead with Director General of the FAO, Q Dong Yu. Floor is yours.
Thank you, Excellencies. Your Excellency, President of the Council of the Ministers of Italian Republic, Professor Mario Draghi. Your Excellency, President of the European Union and Commission, Madame von der Leyen. Ladies and gentlemen, I thank Italy, current G20 presidency and the European Commission for inviting me to this summit. The pandemic will only be over once everyone is safe. Sharing lessons learned, strengthening multilateral collaboration, develop joint action, such as adopting Roma Declaration, will pave the way to this common goal. Our global efforts to achieve the Sustainable Development Goals, including the reach zero hunger by 2030, have been critically compromised. Beyond jeopardizing human health, the pandemic is also disrupting our agri-food system that are core to our health and life. We need to take immediate action to avoid the global food crisis with long-term impact. Almost 155 million people are projected to fall in extreme poverty and food insecurity, with the most vulnerable bearing the greatest burden. FAO has been implementing the flagship hand-in-hand initiative focused on the vulnerable countries, seeds, LDCs, and LLDCs, and designed a comprehensive COVID-19 response and recovery program to proactively address the pandemic's socio-economic impact. This prioritized program aims to mitigate the immediate impacts while strengthening the long-term resilience of agri-food system and sustainability. Strengthening and improving health and agri-food systems must go hand in hand. Healthy diets are crucial in that context, can play a role in addressing both malnutrition and environmental concerns. They are accessible, affordable, safe, equitable, and are culturally acceptable. We can learn from traditional diets, which are science-based and overall balanced, to explore their positive impacts on health and the environment. They are anchored in the economic and social cultural context, which privilege the consumption by the concerned populations. To successfully address all aspects of the pandemic, we must strengthen multi-sector collaboration, support interdisciplinary capacity building, and promote the implementation of One Health across the sectors. The tripartite of FAO, WHO, OIE, together with UNEP, IAEA, World Bank Group, and others, join the G20 other members in the different initiatives to enhance the One Health approach. Global promotion through the Global Action Plan on One Health and its high-level expert panel are important steps. Ladies and gentlemen, to achieve the real impact and the remarkable change, we must scale up joint efforts translating our global mandate into national action plans which are ready and capable. We must build up a coherent movement from high-level discussions to practical implementation on the ground. Let's walk the talk. Global health security and food security must be for all, with no one left behind. FAO welcomes the commitment of G20 and other partners to health security and food security and the readiness to work for a better world together with better production, better nutrition, a better environment, and a better life for all. And today is also International Tea Day. Let's have a cup of tea. And even we don't have a tea break. I thank you all. Thank you.
Director General Dong Yu, thank you very much for emphasizing so much the One Health approach. The One Health approach is also anchored in our Rome Declaration. Now let me turn to President Widodo of Indonesia. President, the floor is yours.
Excellencies, since our last meeting 6 months ago, there is no indication that the pandemic will soon be over. Dr. Tedros, WHO Director General, said that the second year of this pandemic is on track to be far more deadly than the first. Development of new COVID-19 virus variants became its own challenges for the world. Moreover, disparity or gap of global access to vaccines is still immense. While several countries have started vaccinating low-risk groups, namely children and youngsters, there were only 0.3% of vaccine supplies provided for low-income countries. This gap is very real when 83% of global vaccine doses have been received by wealthy nations, while developing countries have only received 17% for 47% of the world's population. I must remind us all that all of us can only be fully recovered and safe from COVID-19 when all countries have recovered. No one is safe until everyone is. Today, the challenge of fair and equitable vaccine access for all is still enormous, such as the issues of supply, financing, and vaccine hesitancy. Therefore, we must take concrete steps, namely, in the short term, we must encourage a more intensive dosage sharing through COVAX facility scheme. This is a form of solidarity that must be strengthened and scaled up, particularly to overcome the problems of supply impediments. In the medium and long terms, we must double vaccine production to fulfill global demand and develop health resilience. Hence, we need to increase production capacity collectively through technology transfer and investment. If the issues surrounding vaccine production capacity and distribution are not resolved, I'm afraid that it will take us longer to resolve this pandemic. Achieving a positive economic growth projection, as predicted by a number of global financial institutions, will very much depend on how we can work together in dealing with this pandemic. Therefore, G20 member countries must provide support for boosting vaccine production as well as equal access to vaccines for all countries. In this context, Indonesia supports the proposal of TRIPS waiver for the prevention and treatment of COVID-19, including for vaccines. Indonesia has decided to become one of the co-sponsors for the TRIPS waiver proposal. Indonesia hopes that other G20 members can provide similar support for the initiative. As the largest vaccine producer in Southeast Asia, Indonesia stands ready to become a hub for expanding vaccine production in the region. Leaders of the G20 countries, excellencies, to face future pandemics, the G20 must become a main actor in the effort to develop a strong global health architecture. Global cooperation is a must. Through a solid political commitment, G20 needs to support a treaty on global pandemic preparedness and the strengthening of the WHO's central role. Equally important, G20 countries must become the catalyst of regional health resilience through enhancing detection and early warning system, along with information sharing mechanism, as well as support for One Health approach. Excellencies, the principles in the Rome Declaration are very important to enhance global health resilience. Yet, those principles will not matter much if it is not concretely implemented. Implementation is key, and the world can only recover and become stronger if we do it together. Recover together, recover stronger. I thank you.
Thank you, Mr. President. Let me now turn to Prime Minister Suga Yoshihide of Japan. The floor is yours.
ご列席の皆様、まず世界中で感染症との戦いの最前線に立ち続ける医療従事者をはじめとした多くの方々の献身的なご努力に対し、深い敬意とともに心からの感謝の意を表します。そして本日、この事業を得た会議を主催されるドラギ首相、フォンデア・ライエン欧州委員会委員長の指導力に敬意を表します。今回の感染症の危機を克服し、将来の健康危機への備えを整えること、そして世界をより良い回復に導いていくこと、こうした我々の重要な責務をしっかりと果たすべく、我が国は多国間主義を重視しつつ、保健分野における国際的な取り組みをリードしていく決意です。新型コロナの収束には、世界全体におけるワクチンなどへの公平なアクセスが要です。開発から配布、接種に至る包括的なプロセスを確保する必要があります。我が国はそのための国際的な枠組みであるアクト・アクセラレーターの創設を呼びかけた国の一つとして、その仕組み作りに貢献してきました。資金面では、COVAX への2億ドルを含め、3億4600万ドルを拠出するとともに、診断や治療の普及を支援してきました。アクト・アクセラレーターの中でも、安全で効果的で質の保証されたワクチンの公平なアクセスの確保は喫緊の課題です。そのため私は6月2日にCOVAXワクチンサミットをガビと共催します。我々は途上国などにおいてもワクチンへの公平なアクセスを確保するために必要な資金を調達すべく、さらに力強い一歩を踏み出す必要があります。このサミットを通じて国際社会の結束を示す、世界に希望を届けることができるよう、皆様からの力強いコミットメントを呼びかけたいと思います。我が国は長年にわたり世界中で誰もが安心して保健医療サービスを享受できるよう最前線で支援してきました。この蓄積を生かし、途上国の一人一人にワクチンを届けるラストワンマイル支援をはじめとした取り組みも関係機関と連携しながらスピード感を持って進めています。新型コロナへの対応の経験を通じ、我々は人間の安全保障の理念のもと、誰の健康も取り残さないとの観点からユニバーサルヘルスカバレッジを実現することの重要性を再認識しました。また保健システムの強化や栄養、水、衛生などの感染症に強い環境の整備、持続的な保健財源の確保の必要性を改めて認識することとなりました。こうした教訓を踏まえ、我が国は本年12月、東京栄養サミットを開催し、世界の人々の栄養改善を推進します。そして最後に、将来のパンデミックに備えるためには、 国際保健システムの在り方を見直すことも必要と考えます。国際保健課題への対応にあたっては、地理的空白を生じさせるべきではなく、世界各国、地域の情報や知見が自由、透明、迅速な形で広く共有されることが重要です。こうした認識のもと、我が国は健康危機への対応における WHO の役割を重視しており、これまで WHO の検証改革の議論に積極的に貢献してきました。引き続き国際社会と手を携えながら、効果的かつ実践的な対策の実施に向け、全力で取り組んでいく決意です。6月のコバックスワクチンサミット、12月の東京栄養サミットに多くの皆様をお迎えできるのを楽しみにしています。ご清聴ありがとうございました。
Thank you very much, Prime Minister Suga. And I'm glad to hear that now Charles Michel, the President of the European Council, is back with us. Charles, you have the floor.
Merci beaucoup. Thank you very much, Ursula. I do hope that this time round it will work. It does seem to be working. Thank you very much, Ursula. Thank you to you too, Mario, for this initiative. It was important for us to come together, even in virtual format. I think we're all in Italy, in Rome, for this meeting in Rome. Now we're faced with a global shock. It's affecting us socially, economically, in health terms. It's also a shock that's placed some of the most personal liberties and freedoms under pressure. Now, we're in the midst of a battle. It's a fight against the clock to beat COVID-19. But at the same time, and that's why we're here today, we've got to actually think about the world beyond COVID, the post-COVID world. Now, there's one hand in hand here in order to ensure that we have fair global access to vaccines. This is a shared responsibility. We all have to be committed to this battle, and there are various specific things that we actually have to do in order to act. Firstly, it's down to us, for all G20 members, to guarantee supply chains. It's our responsibility to guarantee that exports can take place. Various people have mentioned this before me. The European Union, right from the outset, when it comes to production capacity, has tried to make sure that about 50% of doses produced on European territory can be exported, including in the context of the COVAX initiative. And the third point, again, which has been made by very many, is the importance of bolstering production capacity everywhere, in particular on the African continent, but also in Latin America. Now, in recent weeks, we've been able to see African leaders coming together. They were sounding the alarm bells. And against that backdrop, the European Commission, but also with an important role played by the WTO and the WHO, I'd like to say well done to Ms. Iweali. We've been trying to develop this idea of a public-private partnership to mobilize financial capacity in order to deal very specifically with this whole issue. It's not just about intellectual property, but also about technological transfer and know-how transfer so that we can best achieve this objective. And finally, the European Union has also been mobilizing in order to accelerate capacity within our member states and with the European Commission to try and make available doses for partners, in particular for the most vulnerable regions of the world. And we've been committed to that in order to strongly initiate the COVAX project and the ACTA project. And then there's another point that I would really like to deal with briefly. It's about preparing for the future.
So we need to ensure that we make our world more resilient. Now, I would support the call from the independent panel that there be a revision of the international global health governance system. And I'd like to focus on this now. We have proposed that a treaty to deal with pandemics be drawn up. Now, we, along with Dr. Tedros, have made a lot of progress, and with a lot of you as well, we've made progress towards identifying frameworks within which and themes regarding which the international community needs to draw lessons to ensure that international reaction capacity can be bolstered, that we can ensure it will be quicker and more effective in the future. Now, this treaty could cover the need to better prevent crises, so reducing risks, and it could also cover the importance of facilitating the exchange of data, notably scientific data, ensure that there be transparency, and also ensure that in the future we have the ability to better work together on restrictive measures, movement measures which have had to be taken, and also to ensure that we can guarantee supply chains. And I would also welcome the contributions made by the WTO and the WHO on that topic. Now, I know that there are still some concerns, there is still some hesitation when it comes to the idea of this treaty, but I really hope that very quickly we'll be able to allay any concerns and perhaps clear up any misunderstandings which may exist. Now, next week there'll be a very important meeting within the framework of the WHO, and that could be the starting point to launch an operational working group so that we can bring together stakeholders and that we can establish this ambition, namely that we want a legal framework which can enshrine our efforts to draw lessons from the pandemic and to create a more resilient, robust system and society in the future. So those are my concerns, those are my ideas. As Ursula said, as the President of the European Parliament said, the European Union will be there, will be involved in ensuring solidarity along with the international community and in creating a fairer, more solid world in the future. Thank you.
Yes, thank you so much, Charles. And now I have the great pleasure to introduce the Director General of the IMF, Kristalina Georgieva, who is managing the enormous fund for the special drawing rights of 650 billion. Kristalina, the floor is yours.
Thank you very much, Ursula, and many thanks to Mario and to your staff for preparing this vital summit. By now, we all know there is no durable end to the economic crisis without an end to the health crisis. And that means pandemic policy is economic policy, highly relevant for the work of the IMF. How it is conducted matters to economic recovery, and it matters in particular to preventing this dangerous divergence of economic fortunes we have been warning about. It will not only worsen as the gap widens between wealthy countries that have access to vaccines and poor countries that do not, but slow down exits from the economic crisis for everybody. And for this reason, we have published today a contribution to the ongoing debates on how to address the gap in vaccines, diagnostics, and therapeutics that many developing countries face, and help bring the pandemic substantially under control everywhere for everyone's benefits. It builds on the work of WHO, the World Bank, Gavi, African Union. It has three broad elements at the estimated cost of $50 billion. First, vaccinating at least 40% of the global population by end 21 and at least 60% by the first half of 22. To do so would require additional upfront grants to COVAX, donating surplus doses, and free cross-border flows of raw materials so far. Second, ensuring against downside risks such as new variants that may necessitate booster shots. And that means investing in additional vaccine production capacity by 1 billion doses, diversifying production, scaling up genomic surveillance and supply chain surveillance, and contingency plans to handle virus mutations or supply shocks. And third, managing the interim period where vaccine supply is limited, with widespread testing and tracing, therapeutic and public health measures, and at the same time, ramping up preparations for vaccine deployment together with any approved dose stretching strategies. Of the $50 billion, we envisage grant financing of at least $35 billion. G20 governments have already identified as important to address the $22 billion funding gap noted by Accelerator. Thus, this would need to be topped up by an additional $13 billion in grant contributions. The remainder of the overall financing plan, around $15 billion, could come from national governments supported by COVID-19 concessional financing, primarily from facilities already created by multilateral development banks. Importantly, the proposal requires not just commitments, but upfront financing, upfront vaccine donations, and upfront at-risk precautionary investments. It is essential that all necessary financing is available as soon as possible. Well, clearly the costs are not trivial, but they are dwarfed by the outsized benefits. As we have been stressing, a faster end to the pandemic not only saves lives, but also could inject the equivalent of $9 trillion into the global economy by 2025 due to a faster resumption of economic activity. And advanced economies, asked to contribute to most of this effort, would likely see the highest return on public investment in modern history, capturing 40% of the GDP gains and roughly $1 trillion in additional tax revenues. Let me just finish by stating the obvious. Strong and coordinated action is the way out of this unprecedented health and economic crisis. With the support of our membership, we are working towards making an important contribution to the exit from the crisis by boosting global reserves with $650 billion special drawing rights, particularly important for countries faced with the toughest challenges. We are stepping up our lending where needed. We are working on debt sustainability. And Ursula, let me state it, you can count on us. We have been playing our role. We will continue to do so. Thank you.
Dear Kim, the floor is yours.
드라기 총리님, 폰 데어 라이언 위원장님, 각국 정상 및 국제기구 대표 여러분, 코로나19 팬데믹으로 인해 국제 연대와 협력이 어느 때보다 가장 절실한 지금 G20 글로벌 보건 정상회의를 개최하기 위해 힘써주신 의장국 이탈리아와 유럽 집행위원회에 감사의 마음을 전합니다. G20은 2008년 글로벌 금융위기 이후 지속 가능한 포용사회의 청사진을 제시했으며 오늘 로마 선언을 통해 공중보건위기 극복을 위한 중요한 이정표를 마련합니다. 현재 세계 각국에서 백신 접종이 시작되면서 팬데믹 이전으로의 복귀를 위한 장정이 진행 중입니다. 이 과정에서 우리가 잊지 말아야 할 것이 있습니다. 이 회복의 여정에서 전 세계의 어느 누구도 소외되어서는 안 된다는 것입니다. 이번 코로나19 위기에서 우리가 배운 것이 있습니다. 지구와 우리 인류 전체는 하나로 연결되어 있으며 감염병과 기후위기 등 앞으로의 과제는 전 세계가 함께 협력할 때만 해결할 수 있다는 사실입니다. 저는 오늘 로마 선언을 실천하기 위한 원칙으로 세 가지를 강조하고자 합니다. 첫째, 코로나19 위기의 조속한 극복을 위한 백신 생산의 확대와 공평한 보급입니다. 안전하고 효과적인 코로나19 백신이 모든 나라에 공평하게 보급될 때까지는 어느 한 나라도 안심할 수 없습니다. 지금까지 개발된 백신이 신속하고 대량으로 생산될 수 있도록 생산 기지를 추가 발굴하고 원활한 기술 이전과 원료 공급을 통해서 백신 생산 허브를 구축해야 합니다. 후발 백신을 신속하게 개발하고 보급하기 위한 글로벌 임상시험 플랫폼 공유 등의 협력도 강화되어야 합니다. 한국은 코로나19 백신 치료제의 공평한 접근성을 위한 액트 A 및 코박스 AMC에 적극 참여하고 있으며 백신의 위탁 생산을 통해 접근성 확대에 기여하고 있습니다. 코로나19 백신에 대한 접근은 인류 전체의 권리인 만큼 대한민국은 다자주의 차원의 백신 협력에 지속적으로 동참할 것입니다. 둘째, 코로나19 위기로부터 포용적 재건을 이루어야 합니다. 지난 18개월 동안 팬데믹은 전 세계적으로 양극화를 심화시키고 그동안 국제사회가 이룩한 지속가능한 발전의 토대와 성과를 위협했습니다. 이제 각국의 보건의료 시스템이 보다 포용적이고 지속가능한 시스템으로 재건될 수 있도록 국제사회의 투자와 협력이 강화되어야 합니다. 특히 저개발국의 보건을 강화함으로써 공중보건위기를 보다 신속하게 감지하고 통보할 수 있다면 미래의 감염병이 팬데믹으로 이어지는 중요한 연결고리를 차단할 수 있을 것입니다. 한국은 전국민 건강보험제도에 기반한 보편적 의료보장과 사각지대가 없는 촘촘한 사회 안전망 구축을 통해서 포용적 재건과 회복에 힘쓰고 있습니다. 한국은 이러한 경험과 노력을 기반으로 보건취약국의 지속가능한 보건의료 시스템과 보편적 의료보장 구축을 위한 지원 노력에 적극적으로 참여할 것입니다. 마지막으로 중요한 것은 글로벌 보건 거버넌스를 재정비하는 것입니다. 국제 보건 규범의 이행성을 강화하고 현 규범의 한계를 보완하기 위해서는 국제사회의 단합된 협력이 필수적입니다. 한국은 WHO 집행이사국으로서의 책임감을 갖고 국제 보건 규범 개선 노력에 동참할 것입니다. 각국의 정상 및 국제기구 대표자 여러분, 고통스러운 코로나19의 긴 터널을 조속히 빠져나와 금년 하반기 G20 회의에서는 함께 마주보며 포용과 회복의 논의를 이어갈 수 있기를 기대합니다. 감사합니다.
Thank you, Prime Minister. And let me now turn to the President of Mexico, Andrés Manuel López Obrador. President, the floor is yours.
I celebrate our participation in this Global Health Summit. It is a pleasure to see you all, dear colleagues, ladies and gentlemen, public servants and governors of the countries, members of the G20. I celebrate and approve the proposal of President Biden to make available to the people and nations of the world the patents of the pharmaceutical companies that are producing and will keep on producing vaccines for COVID-19. I also consider it to be crucial to strengthen the UN mechanism proposed by our country and supported by almost all other countries around the globe in order to have COVID-19 vaccines be accessible to all nations regardless of their economic, political, or cultural situation. This, unfortunately, has not worked as it should have. It is quite obvious that there is monopolization of vaccine doses by a reduced group of countries, while most countries have access to very few vaccine doses. Up to now, according to official numbers, we have applied 1 1.5 billion doses approximately, and 50 countries have applied 96% of this, while 145 countries have applied only 67 million, meaning 4% of the total. In the name of Mexico, I would like to thank you for the solidarity, for sending vaccines to our country on behalf of the government of China, the US, India, and Russia. I also would like to thank the collaboration in terms of manufacturing vaccines from Argentina and the solidarity and support shown with medical brigades of our sister nation of Cuba. Mexico will keep on facing this pandemic based on international solidarity. Of the plants set up in Mexico for AstraZeneca and CanSino vaccines, we will be sending vaccines to other Latin American and Caribbean countries. Mexico is on its own vaccine, Patria. 30% of its production will be sent to countries in need. Thank you.
Thank you, President Obrador. Let me now turn to Prime Minister Mark Rutte. Mark, floor is yours. Mark, we don't hear you. We don't hear you. Mark?
Hear me?
Yeah, now I can hear you.
Yes? That's great. Again, thank you, Mario, and thank you, Ursula, for bringing us together and for your leadership and commitment in this whole effort. And also, of course, a warm hello to all the colleagues in this meeting. I'm pleased to note in this meeting a broad consensus, which, of course, we expected there would be, but it is also really materializing to make considerable additional investments in the ACT accelerator. And we here in the Netherlands believe this will be crucial to enable equitable global access to vaccines, tests and treatments for all, particularly the most vulnerable. I believe that this investment is needed to combat the COVID-19 pandemic, and it will also help us to reopen the global economy and build back societies in a sustainable and resilient manner. Therefore, the Netherlands recently announced 52 million euros in additional funding for Act A. And this week, we also announced another 10 million for the Global Financing Facility. As you know, we are making these contributions not only to, let's say, increase the availability and, might I add, also distribution of vaccines for low and lower middle income countries, but also to invest in, for example, protective equipment, in diagnostics, in treatments and health infrastructure. And the additional funding brings our total support to Act A to 107 million euros. We will also soon announce that a substantial batch of vaccines will be made available for vaccination programs in vulnerable countries by means of the EU vaccine sharing mechanism and through COVAX. Of course, on all of this, coordination is key, and one way of ensuring better coordination is through a global treaty on pandemics, as mentioned by Angela Merkel, but also by President Joko Widodo of Indonesia. I'm personally very much in favor of such a treaty. It won't, as we all know, solve all the problems we now face, but it will mean that the conversation on policy coherence And the conversation on multilateral cooperation is raised to the highest political level. So I'm looking forward to the outcome, in that sense, also of the discussions of the World Health Assembly next week on this important topic. The external transparency and community engagement are among probably the most important factors in the response to outbreaks. And this underlines the need to refocus and fully focus attention on preparedness and on response mechanisms, not only now, but in a sustainable, let's say, long-term manner. And this should include, I believe, the prevention and detection of zoonotic pathogens by means of a One Health approach. And national health systems and the multilateral system, in particular the WHO, should be able to count on sustainable funding. In that respect, Ursula, we very much welcome the offer you made to further discuss how we can increase vaccine production in the context of TRIPS. In concluding, I believe that we, being today's global leaders, need to take responsibility. We need to forge a stronger global solidarity above and beyond our determination to beat the coronavirus. We need to ensure we have a sound global health and security strategy based on global solidarity. And finally, we must work together to truly build back societies locally, nationally, and globally. It is now the time to act. So thank you, and my best regards to Rome.
Thank you very much, Mark. You have been a supporter of Act A from the very onset on, and thank you very much now for the additional contribution of today. Let me now turn to the World Organization for Animal Health, the Director General, Monique Eloy. Director General, the floor is yours.
Thank you very much, Madam President of the European Commission, Monsieur President of the Council of Ministers of the Italian Republic, Excellencies. I would firstly like to thank the G20 presidency and the European Commission for accepting the invitation to the ORE to attend this important summit. Considering the animal origin of the current COVID-19 pandemic, it's obvious today that we cannot tackle this kind of pandemic without keeping in mind that more than 70% of emerging infectious diseases have an animal origin, and that animal health and human health are closely intertwined. Today, we are also becoming aware that both animal health and human health are closely interlinked with environmental health, and that we must address these issues together. This will allow us to strengthen the implementation of the One Health approach, which is perfectly reflected in the Rome Declaration, which is really welcome. Everything should fit together, and we must not leave any gaps in our collaborative approach and collective approach, because viruses don't know borders. Excellencies, this pandemic provides us with a dramatic reminder of how a silo approach limits our ability to address complex issues, and that a holistic approach to health policies should be incorporated into our shared agenda. Preparedness, resilience have become keywords to which we must add the word prevention, a concept which is crucial when dealing with the control of risk at the animal source. That is the raison d'être of the newly established high-level expert panel, which was set up together with FAO, UNEP, and WHO very shortly after the announcement to establish it was made during the last Paris Peace Forum. This panel will help us by providing robust scientific analysis and connecting the dots. One of its eminent experts rightly said during its first meeting last Monday, zoonoses are only symptoms. The true disease is a disease of our ecosystems. Let's not forget this. Indeed, the issue of risk related to the emergence of pathogens from the animal sector, and more particularly from wildlife living in a regularly destabilized environment, needs to be considered in a more structured way. In this context, enlarging the WHO, FAO, OIE tripartite collaboration to include UNEP, thus creating tripartite plus, is definitely a wise decision. Today, the first lessons learned from the COVID-19 crisis encourage us to urgently deal with these issues, to identify the relevant work programs to combat them, and above all, to act. Political awareness, your awareness of pandemic, and social expectations are higher than ever. Now we must deliver more efficiently and more quickly. But to achieve this, we need well-designed strategy, and we need a strong and long-term political commitment and support from all of you. This support includes appropriate funding, sustainable funding, and appropriate capacity building mechanisms to accompany our members in building strong and interconnected health systems. Research platforms, sustainable laboratories, high transparency on emerging events and data sharing technologies, and last but not least, a well-trained workforce, which includes veterinary services, must be on our agenda. At global level, the multilateral health architecture and a possible international instrument with regard to pandemics prevention and preparedness are under discussion and may be further week. The OIE is ready and interested in contributing to any work which could be initiated. Excellencies, as global leaders, you have a key role to play in addition to what is happening today. Please support us to ensure impact on policies thanks to their effective implementations in the field. And together we'll succeed in preventing the next pandemic. Thank you for your attention.
Thank you, Madame Eloi. Now let me turn to the Deputy Prime Minister, Tatiana Golikova, the Russian Federation.
Distinguished Mr. President, Ms. Chair, ladies and gentlemen, the coronavirus pandemic have revealed the need in the comprehensive approach to Sustainable Development Goals. Our response must be people-centered, life-centered, and health-centered. The globalization provided for interconnectivity of countries and people and requires to forgo confrontation and separation blinds ideology. We need to seek for a common denominator in world affairs and jointly respond to global threats on the basis of international solidarity. Now, all the more relevant is universal access to healthcare, including vaccines, medicine, and diagnostic tools. We believe there is a need to implement G20 appeal in practice to cover the world population with vaccination as a global public good. These tasks require the following steps: to promote cooperation in the WHO, to implement green corridors for delivery of essential goods, to end trade wars and alleviate sanctions, to speed up development and international recognition of medical advances, especially vaccines. The fight against infectious diseases must be based on the WHO international health rules adopted in 2005. They've proved to be efficient, relevant, and demonstrated response criteria to emergency health threats are adequate. Russia is a long-term and reliable WHO partner, a notable donor to its subject matter programs. We develop the meaningful interaction on a wide range of issues, namely IHR implementation, response to health emergencies, fight against tuberculosis, non-infectious diseases, protection of motherhood and childhood. From the very beginning of this pandemic, we've actively engaged into international efforts to neutralize its risks and threats, to curb negative medical and social economic impacts of these infectious diseases. We've delivered huge supplies of personal protective equipment, preventive agents, and medicines, and medical equipment. The ample experience of our country has become relevant in terms of lab diagnostics, digitalization of medicine, as well as the advanced decisions tested during the creation of national and regional offices for comprehensive response to the pandemics. We're committed to enhancing capacity of global health system with the WHO as a coordinator. We will contribute to the full implementation of the IHR, ensure universal access to healthcare. We believe there is room for increasing the added value of the access to COVID-19 tools accelerator and its COVAX pillar. There is a need to speed up the WHO procedure for pre-qualification of new vaccines and expansion of vaccines in the portfolio of the said mechanism. On top of that, we attach special importance to direct cooperation in spreading and distribution of the vaccine. Russia is actively engaged in bilateral channels. For that, they contribute to diversifying supply chains, meeting the demand in partner countries, transferring technologies, arranging local production, and creating jobs. Russia was the first to register the vaccine against coronavirus. We have 3 similar drugs, and we are conducting further developments. Our flagship vaccine, Sputnik V, has been registered in 70 countries. 40% of global population live in these countries. This is on the second place among other similar drugs. The vaccine is being delivered to 35 countries. Its production has already been launched or is being launched in Belarus, India, Kazakhstan, China, Serbia, Turkey, South Korea. The success of Sputnik is easy to explain. It's highly efficient, which is confirmed by international experts. It's safe, easy to transport and store. We will share our experience further. Within the Eurasian Economic Union, we've launched the online application for the safe travels. It's been used since February 2021 in the EAEW countries. The users can easily find the laboratory for PCR testing, get a certificate with the results, and cross the international borders of the states parties. In conclusion, let me reaffirm Russia's commitment to the broadest cooperation possible with all partners concerned for the sake of stable, healthy, and prosperous world. We're willing to jointly create healthy future for the entire humanity on principles of solidarity, multilateralism, and collective response to the acute challenges and threats to sustainable development. Thank you for your attention.
Thank you very much, First Vice Prime Minister. And let me now turn to the Secretary General of the OECD, Ángel Gurría. The floor is yours.
Dear friends, the impact of COVID-19 on the global economy and on people's lives has been without precedent in living memory. Without the tireless dedication of health workers around the world, the tragic loss of life, which stands at 3.4 million lives today and counting, would have been higher still. Now, well over a year into the pandemic, amid an uneven vaccine rollout of the disease, we continue to see health systems stretched to the brink and a pressing need to make them more resilient, more future-proof. We must learn the lessons of this crisis and to respond, to prepare, to prevent. Well, let me offer 3 suggestions. First, we urgently need to accelerate the production and equitable distribution of vaccines. We have seen significant progress in vaccination rates in OECD countries, yet globally, fewer than 1 in 10 people have received at least 1 dose of a COVID-19 vaccine. In the poorest countries, despite record levels of development assistance, that figure is less than 1 in 100. So it is crucial that vaccines are directed towards areas of greatest need, and commitments to sharing intellectual property, facilitating technology transfer, and further developing manufacturing capacity, all of which are needed, by the way, that they are all encouraged. We must also advance international efforts, international tools to tackle misinformation and disinformation, notably on vaccines. Second, we must ensure that global supply chains are working efficiently to get critical health goods where they are needed, or keeping markets open, keeping markets flowing by disciplining export restrictions, by reducing tariffs, by streamlining trade-related processes at and behind the border, are key to ensuring timely access to vaccines and to other essential health goods. We must also promote international regulatory cooperation, increase transparency on essential goods, work with the private sector towards diversified and resilient supply chains, and finally, develop effective buffering strategies where appropriate. Third, we must strengthen health system resilience, focusing on ensuring universal health coverage, strengthening emergency response capacity. That means a well-skilled, adaptable health workforce and health systems that can take advantage of new digital technologies, new digital tools, to prepare for and prevent future pandemics. We also need to set concrete objectives for global financing for health, as well as to put in place comprehensive related data tracking. To this end, most G20 members, with the support of the OECD, are currently working to develop the new measure of total official support for sustainable development, so-called TOSD, and I would like to encourage all G20 members to pursue their efforts to provide transparency on health financing. Now, all of this requires strong, sustained political commitment, and I urge you to carry this momentum to the World Health Assembly, to our G20 Leaders Summit, to every venue, to every platform for multilateral dialogue and cooperation, including the pursuit of an international treaty on pandemic preparedness. It's not going to be easy, it's not going to be fast, but as Mark Rutte suggested, it'll get the conversation going, and then it'll get us prepared in order to face the next time. So count on the OECD as you translate the Rome Declaration into action. Thank you.
Thank you, Ángel. Thank you. Let me now turn to President Ramaphosa, South Africa. President, the floor is yours.
Thank you very much, Prime Minister Mario Draghi, and the President of the European Commission, Ursula von der Leyen, and Excellencies and guests, as well as ladies and gentlemen. I would like to welcome this opportunity to address this gathering, and I'd like to thank you, Ursula, my good friend, for having approached me and asked me to be here. It is good that we are all here to chart a course for collective action in response to both current and future global health emergencies. COVID-19 pandemic has highlighted the extreme vulnerability of our national health systems, and has also showed up the great burden of this pandemic that we have. It has highlighted once more that investing is key to economic prosperity and to progress in human development. Now, as much as COVID-19 has exposed our weaknesses, it has also brought out our strengths to the fore. There's been, quite frankly, unprecedented collaboration between countries and a massive show of solidarity, particularly with vulnerable communities and societies right across the world. And when I was chairperson of the African Union, when the pandemic broke, many of my colleagues on the African continent, in developing and implementing the Africa Joint Continental Strategy for COVID-19, we established an African Union COVID-19 Response Fund, capitalized by member states, as well as international partners and the private sector. And we were able to raise a fund, however small it was, but it was a great demonstration of political will on the continent. We set up the groundbreaking African Medical Supplies Platform to assist with equitable access to medical supplies, diagnostic tools, and therapeutics. And this was unprecedented, and it demonstrated the ability of Africa to move towards real meaningful integration, even at the economic level. Last year, we set up an African Vaccine Acquisition Task Team to secure vaccines for all countries on our continent. Throughout, we have drawn on the continent's expertise, our capabilities, and institutions such as the Africa Centers for Disease Control and Prevention. For this Global Health Summit to achieve its aims, we must share lessons and best practice on how we are dealing with this current pandemic. We must also show our commitment to equitable access to tools, to supplies, to vaccines, to therapeutics and diagnostics. We must do away with health and vaccine nationalism, where each one of us tries to advance our own interests without looking at the collective interests that we need to advance as we address this global pandemic. It is for this reason that we must review the international intellectual property and patent regime and determine with regard to how it should be applied in the event of global health emergencies. We are in a global war against a pandemic. And when you are in a war and you are all allies, you must use all your weapons without hiding behind profit at the expense of lives. I'd like to believe that that is the natural thing that we should all do. In this regard, that's why we are calling on all countries to support the call that has been made by India and South Africa, and now supported by well over 100 countries around the world, to support a temporary waiver of the World Trade Organization Agreement on Trade-related Aspects of Intellectual Property Rights, that is TRIPS. Enable countries to produce COVID-19 vaccines so that they too must have the weaponry to engage in this war against this pandemic. Would like to thank Ursula von der Leyen, President of the EU Commission, and also what was said by David Sassoli, the President of the European Parliament, for their stated intention to engage in discussions at the WTO on this matter. And I do look forward to a successful conclusion of the discussions in this regard. What you have articulated has really been progressive and can take the whole world forward. Such a waiver would enable developing countries, in particular, to expand their pharmaceutical sectors, to facilitate technology and skills transfer, and above all, at this point in time, save lives. Because truth be told, it is simply not acceptable. And it cannot be justified that in this 21st century, Africa has only received some 20 million vaccine doses, which is a paltry 2% of the global supply. And right now, the statistics tell us that in the more developed economies, 1 in 10 people have now been vaccinated, and in the less developed economies, it's 1 in more than 100. We should hang our heads in shame. Future generations will not forgive us if we do not do the right thing now. We would like to thank those countries that have made financial contributions to COVAX and allowed exports of vaccines as well. I'd like to say that South Africa supports the establishment of a Global Health Council to strengthen preparedness and response mechanisms in anticipation of future global and national pandemics. Safeguarding human health must be our collective responsibility. And South Africa also supports the principles of the Rome Declaration. We are confident that this summit will be a turning point in our quest not only for equitable access to vaccines and diagnostics and therapeutics that are so needed now to overcome this pandemic, but also to equitable healthcare for all in the future. Now, as we approach this task, let us be guided by the words of the father of our nation, Nelson Mandela, who said, "None can succeed without the success of the other." And if we keep that in mind, we'll be able to act collectively for all the people of the world. I'd like to thank you. Thank you.
Thank you very much, Cyril, for your words and the description of what lies ahead of us. And thank you for the excellent cooperation. I would like to turn now to the President of the World Bank. Dear Robert Malpass, you have the floor.
Thank you very much. Excellencies, thank you, Prime Minister Draghi and President von der Leyen. I share the intensity and deep emotions of previous speakers in combating the pandemic. Together, we need to find faster and more effective ways to get vaccines to people in developing countries and to plan for future health emergencies. I'd like to present the actions of the World Bank Group to tackle the pandemic and our plans to build preparedness for future health threats. I welcome your input and have been very pleased to hear the support of participants for the IDA 20 replenishment, which provides a vital part of the global health platform. In the first year of the pandemic, the World Bank Group committed $108 billion to help countries respond to health, economic, and social impacts of the pandemic. This included a record 65% surge in IBRD and IDA commitments in 2020. We're rapidly expanding our commitments to health, climate, and Africa while working worldwide with all stakeholders. We've also authorized $12 billion to help countries assess and deploy vaccines with the goal of vaccinating 1 billion people in developing countries. By mid-year, we expect to have vaccine support operations in 50 countries with at least $4 billion committed. This week, we launched a website to make all information about our vaccination projects easily accessible in one place. The website includes the detailed vaccine financing operations in place for each country and the results of the readiness assessments conducted over the past 6 months. We urge countries, manufacturers, vaccine intermediaries, and on-the-ground providers to increase the transparency of their own commitments. This will facilitate fair access to vaccines, more effective financing, and the private sector investments that can expand supply. In addition to firm and binding contracts, many announced agreements take the form of best efforts, letters of intent, memoranda of understanding, future funding pledges, and advance purchase options. Each can be valuable, but as Kristalina just said, as many contributions as possible should be upfront, fully funded and delivered. It's vital that we match excess vaccine supplies with delivery schedules and vaccination programs that are well-planned and well-funded. The countries receiving vaccines need to know which types of vaccines will arrive, when, and at what price, so they can communicate with their people and prepare for a major vaccination effort. In sum, I urge countries with excess supplies to release their supply doses, their surplus doses, as soon as possible to developing countries that have vaccination operations already in place. And I urge all of us to increase the transparency of these delivery commitments. Regarding vaccine supplies, IFC is making debt and equity investments in health projects and is helping developing countries manufacture vaccines and related supplies. As we speak today, Mokhtar Diop, the head of IFC, has been meeting with potential manufacturing hubs in Africa and building partnerships with development finance agencies. We'll be announcing positive developments on this front in coming weeks. Looking forward, the negative impact on human capital will be deep and may last for decades. Over 1 billion children have been out of school and 80 million children have missed out on basic childhood vaccinations. At Tuesday's Summit on Financing of African Economies, I announced our commitment to provide $150 billion in financing for sub-Saharan Africa over the next 5 years, a dramatic step up on previous years. This draws heavily on contributions from IDA donors, the World Bank Group's strong leveraging and mobilization capabilities, and the reflows from previous loans. Each year, IBRD is one of the largest contributors to IDA. IBRD itself is one of the largest contributors to IDA, substantially increasing the concessional nature of IDA funding that is vital for the poorest countries. It will take large new resources to build resilience to shocks. Many low and middle income countries need stronger health systems, both for their COVID-19 vaccination campaigns to succeed and to be able to manage and recover from future outbreaks. Pandemic preparedness means investments across sectors, not just in health. The COVID-19 pandemic has shown in particular that social safety nets that provide digital cash transfers are particularly valuable, adding to the resilience of food security, basic health, and education. To build preparedness, we need major investments in infrastructure and digital connectivity. These are crucial, while maintaining our focus on the particular risks to women, girls, the poorest, and the most vulnerable. And with about 75% of emerging infectious diseases coming from animals, we must invest in sustainable and safe food systems. Supporting crisis preparedness and response are integral to the mission of the World Bank Group. It's one of the themes for IDA 20 and crisis preparedness and responses are already embedded into our IBRD operations. The World Bank Group is committed to the health agenda. By working together, we can help developing countries to build resilience that they need when they face major threats to their people's health. Thank you all.
Thank you, David. Thanks a lot for your contribution. Let me now turn to Prime Minister Sanchez. Pedro, the floor is yours.
Gracias. Thank you, Mario, Ursula. Let me start by commending the Italian G20 presidency and the European Commission for the initiative to co-host this summit. As we continue to mourn the millions of victims of COVID-19, it is crucial that we redouble our efforts to end the current pandemic and be readier for future ones. Spain is firmly committed to improving the global health architecture and to translating the urgency that brings us together today into concrete action. Our first priority must be putting the COVID-19 pandemic behind us. The pace of vaccinations has accelerated across the European Union. This will allow for a gradual reopening of our societies. And I'm hopeful that two multilateral initiatives that Spain has championed, the EU COVID-19 certificate and the OECD blueprint for safer international travel, will make a difference in facilitating mobility between most of our countries. But we still stand way behind on our goal to ensuring affordable and equitable access to vaccines for all. The gap between countries is increasing, and future needs might not be fully met. It is not only a matter of justice, it is a matter of ensuring we fight the pandemic efficiently and with all the means and instruments at our disposal. Many voices and countries have been calling for a temporary waiver of the TRIPS agreement or for overriding some of its requirements. Spain firmly believes that we must urgently find consensus on such proposals. But license and intellectual property rights are just one part of the equation. That is why my country is proposing to act simultaneously on the three fronts that need action: facilitating the transmission of necessary technology and expertise, lifting all barriers to ramp up production, and accelerating vaccine distribution. First, until an agreement is reached in the World Trade Organization, we need to foster voluntary licensing agreements, as well as the pooling of all forms of knowledge related to the virus, including through platforms such as the World Health Organization, CTAP, which Spain has just joined. Second, we need to make full use of existing manufacturing capacities, no matter where they are. This requires not only quickly identifying these resources to match supply with demand, but also removing all obstacles to trade off both finished vaccines and the raw materials and components necessary to produce them. I want to acknowledge here the good news that the key vaccine makers have shared with us during the pre-summit, that they are going to accelerate and increase substantially the production of vaccines, most of which will go to developing countries. Every extra dose counts. And third, vaccine distribution needs to be accelerated and facilitated. We must strengthen our commitment to ACT Accelerator and COVAX, increasing financial and non-financial contribution. Spain will play its part, starting with the donation of 7.5 million doses to Latin American partners through COVAX. And this is why, at the European level, myself and other countries are calling for enhancing our coordination through the European Union vaccine sharing mechanism that we are building together. Still, for these vaccines to reach their final recipients, we must also mobilize adequate transportation means and make sure that all countries have the necessary capacities to roll out their vaccination programs. There is no better short-term economic policy than accelerating vaccination campaigns worldwide. Ensuring universal access to vaccines must be the first step to building back better. Dear colleagues, dear friends, as we start to see the end of this nightmare, we cannot afford to put pandemic preparedness and response on autopilot once the COVID emergency is under control. It is time to leverage the current political and societal momentum to move forward with long-term improvements that we need. In this regard, Spain calls for an international treaty on pandemics to provide continued political backing for the prevention, early detection, and management of future pandemics. This treaty would foster mutual accountability, shared responsibility, transparency, and cooperation. Moreover, we must ensure that the multilateral health system with the World Health Organization at its core is sustainably financed and empowered to address future pandemics. Because health expenditure is not a cost, but an investment, and there is a clear need to invest in local capacities, in improving primary healthcare and expanding universal health coverage, in scientific research and innovation, and in health education. Ultimately, my dear friends, one health approach is required to deal with the challenges of tomorrow. One that takes into account that human health and environmental protections are two sides of the same coin. Collective responsibility falls upon us to ensure that our children and our children's children are better prepared than we were to tackle the next global health crisis. We cannot disappoint them. Gracias. Thank you.
Thank you very much, Pedro, and thank you very much for pledging another amount of vaccine doses. Thank you very much for that. And let me now turn to the President of Turkey. President Erdogan, you have the floor.
Kıymetli devlet ve hükümet başkanları ile Avrupa Birliği Komisyonu Başkanı, saygıdeğer katılımcılar, sizleri şahsım ve milletim adına en kalbi duygularımla selamlıyorum. G20 dönem başkanı İtalya'ya ve Avrupa Birliği Komisyonu'na bu toplantıyı düzenledikleri için teşekkür ediyorum. Zirvemizin başarılı geçmesini, ülkelerimiz için ve tüm insanlık için hayırlara vesile olmasını diliyorum. Bugün kabul edeceğimiz Roma Bildirgesi'nin hazırlanmasına katkı veren, destek olan herkese şükranlarımı sunuyorum. Koronavirüs salgını, dünyada en büyük mutluluğun sağlık olduğunu bizlere bir kez daha hatırlatmıştır. Türkiye olarak bu anlayışla salgının ilk günlerinden itibaren elimizdeki imkanları vatandaşlarımızla beraber dost ve kardeş ülkeler içinde seferber ettik. Temel sağlık ekipmanları ve araçlarının hızlı bir şekilde geliştirilmesi, üretilmesi ve dağıtılmasını sağladık. 158 ülke ve 12 uluslararası kuruluşa yerli solunum cihazları da dahil muhtelif kalemde tıbbi cihaz ve ekipmanı gönderdik. Gelişmekte olan bazı ülkelerin üretim kapasitelerini güçlendirmek için kişisel koruyucu malzeme üretilmesine yönelik eğitim programları düzenledik. Dezavantajlı grupların ihtiyaçlarına özel önem verdik. Ülkemizde misafir ettiğimiz 4 milyon sığınmacının sağlık hizmetlerine erişimini kesintisiz sürdürdük. Bugün itibariyle 12 milyonu ikinci doz olmak üzere toplam 27 milyondan fazla aşılama gerçekleştirdik. Yerli aşı üretim çalışmalarımızı da devam ettiriyoruz. Öte yandan aşıya erişim konusunda küresel ölçekte ciddi adaletsizlikler yaşandığını görüyoruz. Dünya genelinde şimdiye kadar tatbik edilen aşıların %80'i yüksek veya üst orta gelirli ülkelerce kullanıldı. Gelişmiş ülkelerde nüfusun çoğunluğu en az bir doz aşılanmışken Sahra altı Afrika'da bu oran %1 dahi bulmadı. Benzer vahim tablolar dünyanın 100'e yakın ülkesinde de yaşanıyor. Türkiye olarak bugüne kadar elimizdeki aşıları diğer ülkelerle paylaşmaya gayret ettik. Yerli aşımızı hazır olur olmaz vatandaşlarımızla beraber inşallah tüm insanlığın istifadesine sunacağız. Çok taraflı finansal kuruluşların ve girişimlerin aşıya adil erişim konusundaki çabalarını destekliyoruz. Kıymetli katılımcılar, salgınlara karşı alınacak kontrol tedbirleri koordineli ve orantılı olmalı, sağlık ve ekonomi arasındaki hassas dengeyi gözetmeli ve Dünya Sağlık Örgütü'nün merkezi konumunu pekiştirmelidir. Bu bağlamda aşılanmış ve aşılanmamış olanlar arasında yeni duvarlar örülmesine ve yeni tür bir ayrımcılığa yol açılmamalıdır. Dünya Sağlık Örgütü'ne üye herhangi bir ülkenin bu örgütün onayladığı bir aşıyı kabul etmemesinin izahı yoktur. Uluslararası seyahatler ve turizmin önü gerekli sağlık ve hijyen şartları sağlanarak açılmalıdır. Küresel sağlık sisteminin güçlendirilmesinin yolu, Dünya Sağlık Örgütü'nün merkezi rolünün tahkim edilmesinden geçiyor. Bu amaçla yürütülen reform sürecine biz de destek veriyoruz. Bulaşıcı hastalıkların yayılmasını engellemek için hızlı tespit, erken uyarı ve yakın bilgi paylaşımı önemlidir. Salgın ülkemizde henüz vaka görülmeden yakın takip altına alınmış, bilim kurulumuz ilk vakanın tespitinden yaklaşık 2 ay önce faaliyete geçmiştir. Milli operasyon merkezlerimiz arasında bir koordinasyon mekanizması tesis edilmesi, tahliyeler ve acil tıbbi ihtiyaçlar gibi çalışmaların eş güdümü bakımından faydalı olacaktır. G20 ülkeleri arasında iyi uygulamalar veri bankası kurulması, gelecekteki krizlere karşı önlem alınmasını kolaylaştıracaktır. G20 platformu olarak hayata geçirdiğimiz borç ödemelerinin ertelenmesi girişimi de salgının küresel bir borç krizine dönüşmesine mani olmuştur. Değerli dostlar, son 1,5 yılda yaşadıklarımız bizlere uluslararası sistemde görülen aksaklıkları gidermek ve daha adil bir düzen inşa etmek bakımından çok güçlü bir ders vermiştir. Sağlık bir ayrıcalık değil, herkes için bir haktır. Evlatlarımıza daha adil, daha yaşanabilir, daha müreffeh bir dünya bırakmak hepimizin ortak görevidir. Türkiye olarak böyle bir dünyanın tesisi için çalışmayı sürdüreceğiz. Bu düşüncelerle sözlerime son verirken zirvemizin başarılı geçmesini diliyor, sizleri bir kez daha saygıyla selamlıyorum.
Thank you. Thank you, President Erdogan. Your support for equitable access to vaccines and sustainable financing efforts are very welcome. Let me now turn to Director General Ghebreyesus of the WHO. Dr. Tedros, the floor is yours.
Thank you. Thank you, Your Excellency, Prime Minister Draghi and President Ursula von der Leyen, Excellencies, dear colleagues and friends. I would like to thank the Italian G20 presidency and the European Commission for their leadership in initiating the Rome Declaration. We welcome the declaration, especially the commitment to support and enhance the existing multilateral health architecture for preparedness, prevention, detection, and response, with an appropriately, sustainably, and predictably funded, effective WHO at its center. And we welcome the other commitments to strengthening national and global preparedness for preventing future pandemics. But our commitment to the future is measured by our actions today. Yesterday alone, more than 13,000 people around the world lost their lives to COVID-19, 9 every single minute. Today, the number will be similar, and tomorrow, and next day. And people will continue to die as long as the global disparity in vaccines persists. Yes, the rapid development of COVID-19 vaccines is a triumph of science, but their inequitable distribution is a failure for humanity. Almost 90% of all vaccines administered globally have been in G20 countries. We can only end the pandemic if everyone has the tools to stop it. So today I have 3 requests. First, end this pandemic with a combination of tailored public health measures and the equitable distribution of vaccines. We call on G20 countries to fully fund the ACT Accelerator as a matter of urgency, to share more doses faster through COVAX. We thank all countries that have announced generous donations today towards the hundreds of millions of doses we will need in the coming weeks and months. And we appreciate today's commitments to scale up manufacturing through sharing technology and know-how and waiving intellectual property provisions with a focus on Africa. The G20 has all the means to vaccinate the world, and the world cannot wait any longer. Second, strengthen health security nationally and globally. We welcome the commitments of the Rome Declaration to support the full implementation of the international health regulations and for a multi-sectoral, all of government, all of society, evidence-based One Health approach to health security. WHO remains committed to working with all member states to explore every avenue for keeping the world safer, including the proposal for a treaty on pandemic preparedness and response. We believe such a treaty would create a high-level framework for political accountability that redefines the way countries deal with health emergencies, and that would encompass all countries, not just the richest and most powerful. The treaty could address the challenges we're facing now. And third, drive progress toward this universal health coverage in all countries based on strong primary health care. The pandemic has demonstrated that health is not a luxury, but the cornerstone of political stability. This will not be the last pandemic. We might be able to prevent some, but we cannot prevent them all. Business as usual will produce the usual result, a world that's unsafe, unprepared, and unfair. But with bold ideas, bold commitments, and bold leadership, we can write a healthier, safer, fairer future for our children and our children's children. I thank you. Grazie mille, Prime Minister, and back to you.
Thank you.
Thank you so much, Dr. Tedros, and thank you so much for you and your staff's tireless work since way more than a year now on this pandemic. Now I have the pleasure to introduce the Prime Minister of the United Kingdom. Boris, the floor is yours.
I'm very grateful to President von der Leyen and Prime Minister Draghi for bringing us together today. And I want to remind everybody, certainly my fellow Europeans, that Western literature begins with a bitter political fight about how to handle a zoonotic plague. Because, as you will recall, the Iliad, the fountainhead of Western literature, opens with a row between Achilles and Agamemnon after a fatal new zoonotic disease arrives, hitting first the mules, and then the dogs, and then the human beings. And if you recall, Achilles is very much in favour of pulling out, and he'd have been very much in the pro-lockdown party, and he says they need to get out of there, whereas Agamemnon vehemently disagrees. And the bust-up basically begins the whole conflict of the Iliad between the armies of the Greeks. My point is that almost 2,800 years later, the world has been just as disunited, I'm afraid, as Achilles and Agamemnon. And I think now is the time to come together and to defeat the pandemic and to prevent another. And the UK is very proud of many things that we're contributing. We're playing our part in developing, obviously, the Oxford AstraZeneca vaccine, together with a non-profit global pricing agreement, contributing £800 million to ACTA, helping to establish COVAX, sharing our surplus vaccines when we have them, because, as everyone says, no one is safe until everyone is safe. And we need to go further, assisted by today's Rome Declaration, in establishing collective defence against future health threats, much as we have against military threats. We need to summon the spirit that forged global cooperation in the aftermath of the Second World War to establish a treaty on pandemic preparedness, working through the World Health Organization to enshrine the actions that each country needs to take in safeguarding everyone against another COVID. And I believe that includes the measures the UK has put forward in our 5-point plan, with common protocols on how countries respond in pandemic times, such as zero tariffs on key medical equipment. We need a global network of zoonotic research hubs so we can identify dangerous pathogens likely to jump from animal to human, from dogs to mules to human beings, to go back to the Iliad, or from bats to pangolins and so on. And harnessing the power of genomic surveillance, in which the UK has been leading the way, we need an early warning system for new COVID variants and new emerging diseases. And this can also help accelerate the production of vaccines, therapeutics and diagnostics from the 300 days of this pandemic to 100 days in future. So, as President of the G7, the UK asked the Wellcome Trust to work with international partners on a proposal for a worldwide network of surveillance centres, like a global pandemic radar. And I met with my good friend Tedros yesterday to discuss how we might take this forwards. The UK will be playing its full part and seeking to build on all the measures in today's declaration at our G7 in Carbis Bay next month. Because now is the time to move away from the temptations of competing nationalism, the sauve-qui-peut approach, and instead reassert the power, the duty, the necessity for nations to act together, building collective defence against the common enemy of disease, and protecting all our people for generations to come. Thank you all very much.
Thank you, Prime Minister Johnson. I welcome your proposals in relation to disease surveillance, both for variants and for emerging and re-emerging infectious diseases. It is a good example of one of the principles of this declaration that we have in front of us today. And I look forward to working with you on this in our next G7 meeting, as you suggested, and more broadly with all our international partners. Let me now turn to the Vice President of the United States of America, Kamala Harris. Vice President, the floor is yours.
Greetings to your excellencies, distinguished colleagues, and esteemed leaders of the international community. I want to extend my gratitude to Prime Minister Mario Draghi and President Ursula von der Leyen for convening this Global Health Summit. Today, our world has entered a new era. The COVID-19 pandemic has made it clear that global health cannot be on the periphery of the work we do as an international community. It must be at the center of our work. Global health impacts our global economy, our global security, and our collective future. We must begin, of course, by ending this pandemic. People around the world are still contracting COVID-19. People are still dying every day. And that is why we need to get people vaccinated as quickly as possible in every nation. COVAX is helping the global community distribute vaccines equitably. The United States is a proud investor in this effort, as I know many of you are. In April, we announced that we would send 60 million AstraZeneca doses to countries around the world. Earlier this week, our President announced that he will soon send an additional 20 million doses of authorized vaccines from the United States worldwide. And we will keep donating excess supply as it is delivered to us. While we work to end this pandemic, we also know that we must do everything in our power to prepare for the next one. Last month, more than 40 United Nations delegations joined a dialogue about pandemic preparedness and response. And I spoke then of the need to be ready, resilient, and responsive. And today I'd like to speak candidly about what we must do within this next year to meet this need. On COVID-19, I believe we can agree the world was not ready. Globally, there were few incentives in place to encourage preparedness. There were gaps in our metrics to measure preparedness, and the mechanisms in place to respond effectively and ensure accountability were far too slow. We have the opportunity now to change this before the next crisis hits. And we must establish a new and sustainable mechanism to finance health security, one that goes beyond emergency relief and that promotes readiness. At the country level, we must budget for health security as we do for national security, ensuring that the actions we take this year are not a one-off. To some, the cost to prepare may seem high. However, the cost of failing to prepare is far higher. Beyond financing, we must also improve the metrics and milestones by which we are measured. One metric I would like to recommend is around the leadership of heads of state, because you see, for far too long, I believe health has been too often relegated to the domain of health leaders. Well, friends, in this era, we must all be health leaders. This is imperative. Finally, we must take bold action on oversight. The United States has called for the United Nations to establish a facilitator for high-consequence biological threats. Just this month, other experts recommended a similar Global Health Threats Council. These two ideas share one principle. Our world needs a group of leaders who are prepared to act without hesitation at the first warning. That's how we stop an outbreak from becoming a catastrophe. And I know some are eager to work toward a pandemic treaty. While we understand the intent, the United States believes that we need to first strengthen our foundation. Thankfully, we have opportunities to come together to do just that. Today's summit and the Rome Declaration are opportunities. The World Health Assembly, the G7 Leaders Summit, the G20, all opportunities for us to work together to get this right. The United States is committed to getting this right. The fate of our economies, our security, and our world depends on what we do now. So let us get to work. Let us work together. Thank you.
Thank you very much, Vice President Kamala Harris, for your clear and strong words. And now I have the pleasure to introduce the Director General of WTO, Dr. Ngozi. Dr. Ngozi, many of the topics concerning WTO were in the center of the discussion today. The floor is yours.
Well, thank you so much, President von der Leyen and Prime Minister Draghi. Thanks to the EU and the G20 for pulling together this summit. Excellencies, ladies and gentlemen, friends, COVID-19 has made clear that we as policymakers need to think of preparedness, response, and resilience as one interconnected package. International cooperation on trade is important for all three elements, as the draft Rome Declaration recognizes. In the current pandemic, after initial disruptions, trade has been a force for good, enabling access to much-needed medical supplies. Even as global merchandise trade shrank by 7% in value terms last year, trade in medical supplies increased by 16%. For personal protective equipment, it was 50%, and for face masks, over 200%. And as we all know by now, COVID-19 vaccines rely on sophisticated multi-country supply chains. The famous example we've all been using is the Pfizer-BioNTech vaccine that uses 280 components from 86 sites across 19 countries. In the wider economy, open, predictable international markets are necessary for the strong and job-rich recovery we need. At the WTO, economists have projected that global merchandise trade will grow by 8% this year, and accelerating vaccine rollout could push this over 10%. But there's considerable divergence across regions. As with the IMF's projections of divergent growth, it is countries with low vaccine access and limited fiscal space, many in Africa, that are being left behind. WTO members can contribute to vaccine equity by acting on three fronts. First, tackling supply chain issues holding back vaccine production, from export restrictions and excessive customs bureaucracy to problems accessing raw materials or hiring skilled workers. The WTO can help with supply chain monitoring and transparency. Second, helping manufacturers scale up by keeping supply lines open and matching underused capacity with unmet needs. One clear takeaway from our meeting with vaccine manufacturers last month is that production facilities exist in emerging markets and low-income countries, Pakistan, Bangladesh, South Africa, Senegal, and so on. And if these cannot be turned around overnight, they could be turned around within months to produce COVID-19 vaccines. This is necessary to save lives now. In the longer run, especially if COVID stays with us for years, we need a more geographically diversified global vaccine manufacturing base. And it is really heartening to me to hear so many leaders speak of this today and speak of their willingness to support this. Having less than 0.2% of manufacturing capacity in Africa is not a recipe for supply resilience. International organizations can facilitate cooperation and investment here as well. And the WTO will work with the WHO, Gavi, and CEPI on the COVAX Vaccine Manufacturing Task Force to improve equitable access. And finally, we must address issues related to technology transfer, know-how, and intellectual property, including the TRIPS waiver proposal. Let me thank all the leaders who have spoken today in support of the ongoing discussions at the TRIPS Council of the WTO. I'd like to thank them for their willingness to move this along, because we must act now to get all ambassadors to the table to negotiate a text. This is the only way we can move forward quickly. We can't move forward with speeches and polemics. We have to sit down and negotiate if we want to save lives. I'm hopeful that by July, we can make progress on a text, and by our 12th ministerial conference in December, WTO members can agree on a pragmatic framework that offers developing countries near automaticity in access to health technologies, whilst also preserving incentives for research and innovation. In closing, I invite you to imagine how the next crisis could look if we adhere to the principles set out in the Rome Declaration. We would have invested the billions in surveillance and health systems that can save trillions in economic support and foregone output. We would have catalyzed the innovation we need while ensuring equitable access for people in poorer countries. A successor to Act A would not face an $18.5 billion funding gap, despite immense returns on investment. Meetings like this one might be less urgently required. And as happy as I am to see everyone today, this is a scenario we really need to make worth turning into a reality. Thank you.
Thank you, Director General. I'm very much looking forward to working with you in our efforts to promote vaccine equity by enabling open supply chains, by scaling up manufacturing efforts through the best use of intellectual property, and knowledge transfer Let me now turn to President Tshisekedi of the Democratic Republic of Congo and President of the African Union. President, the floor is yours.
Madame la Présidente de la Commission de l'Union européenne, Monsieur le Président du Conseil des ministres de la République d'Italie, je voudrais avant toute chose vous remercier en tant que co-organisateur de cette importante réunion internationale qui se focalise aujourd'hui sur la Covid-19. Excellences, Mesdames et Messieurs, les chefs d'État et de gouvernement, Mesdames et Messieurs, l'Afrique, tout comme l'ensemble des continents, est touchée par la pandémie à Covid-19. Les souffrances que cette dernière cause à la planète tout entière, souffrances encore bien palpables en ce jour, justifient ces assises. En effet, les dégâts provoqués par cette pandémie sont énormes en termes d'incapacité et de pertes en vies humaines. Outre l'aspect purement sanitaire, les conséquences de la pandémie à Covid-19 continuent de représenter une menace pour la stagnation ainsi que la fragilisation des économies. Et ce, même pour les économies les plus performantes de la planète. Au regard des conséquences infiniment désastreuses causées par cette pandémie, notamment en ce qui a trait à son impact sur le développement de nos sociétés et les pertes économiques y engendrées, nous pensons que l'Afrique, autant que le reste du monde, se devrait de saisir l'opportunité qui s'offre ici d'analyser et de pallier comme un seul homme aux dysfonctionnements qui nous ont menés à ces atermoiements. Un tel exercice s'entrevoit comme l'une des seules conditions de possibilité de mise en œuvre par la communauté internationale de réactions calibrées en prévision d'éventuelles pandémies futures. Il nous semble par ailleurs important d'insister sur le fait que, pour les pays à revenus limités, la lutte contre les pandémies futures rappelle la nécessité de la construction de systèmes nationaux de santé pour qu'ils soient efficaces et résilients afin de couvrir les besoins essentiels de protection d'un plus grand nombre de nos concitoyens. C'est le sens que nous accordons à l'accélération des progrès vers la couverture santé universelle. Celle-ci aiderait la mise en place de systèmes de santé qui soient à même de répondre aux épidémies, aux urgences ainsi qu'aux catastrophes sanitaires ultérieures. Le renforcement de ces systèmes de santé nécessite une coopération internationale qui appelle la solidarité de tous. Ces systèmes de santé devront intégrer les avancées technologiques les plus récentes en plaçant l'humain au centre en vue de garantir des réponses efficaces et efficientes aux situations futures. Excellences, Mesdames et Messieurs, lors de la réunion virtuelle des ministres africains de la Santé qui s'est tenue ce 8 mai 2021, une stratégie continentale de lutte contre la pandémie de Covid-19 a été adoptée. Il m'importe d'en mentionner ici les points essentiels, à savoir la nécessité d'élargir la capacité de production des outils de diagnostic, des médicaments, des vaccins ainsi que des équipements essentiels pour la santé. L'importance de la proposition américaine de soutenir l'OMC dans le but de lever la restriction au brevet sur le vaccin, levée de restrictions qui augmentera la disponibilité des vaccins au bénéfice de nos populations. La nécessité d'une version adaptée de la stratégie continentale commune qui mette l'accent sur le renforcement de la prévention, du suivi et du traitement dans le but de faire face avec plus d'efficacité aux mutations du virus de la Covid-19 sur le continent, ainsi qu'aux fluctuations inhérentes à la nature de cette pandémie à l'échelle mondiale. La nécessité de soutenir la poursuite de la collaboration entre le CDC Afrique, l'OMS et les autres partenaires en vue d'augmenter la capacité de préparation et de riposte contre la pandémie sur le continent africain. Excellences, Mesdames et Messieurs, nous ne pouvons pas faire face aux défis de la pandémie actuelle sans unir nos efforts et mettre en commun nos savoirs. Au nom de mon pays, ainsi qu'au nom du Bureau des chefs d'État de l'Union africaine, je remercie à nouveau la présidence italienne du G20 et la Commission de l'Union européenne, ainsi que tous ceux qui ont contribué depuis des mois à la rédaction de la déclaration qui nous est proposée. Nous souscrivons donc pleinement aux principes qui sont énoncés dans cette déclaration et appelons de tous nos vœux à ce que ces principes se traduisent par des actions concrètes qui puissent contribuer à vaincre la pandémie actuelle et à nous prémunir contre les dangers que représenteraient les épidémies futures. Je vous remercie.
Merci beaucoup, Monsieur le Président. And let me turn now to the CEO of CEPI, Richard Hatchett. You have the floor.
Von der Leyen, Prime Minister Draghi, thank you for organizing this important summit and for investing in pandemic vaccine innovation through CEPI. Excellencies, distinguished colleagues, friends, I'm honored to join you here today as an ACT Accelerator partner and co-founder of COVAX, and feel privileged to share insights gleaned from 17 months of hard struggle against SARS-CoV-2. Sadly, despite decades of warning and effort, despite an accelerating cycle of global infectious disease crises, and because a series of small steps were taken over many years when large ones were required, we were not prepared to respond when the pandemic we all feared suddenly materialized. And we are staring at the consequences. Already more than 165 million confirmed cases, more than 3.4 million confirmed deaths. We know that these counts are incomplete. Independent reckonings of excess deaths estimate that the true toll has been far higher, between 7 and 13 million deaths. Walter Benjamin, in his theses on the philosophy of history, observes that the tradition of the oppressed teaches us that the state of emergency in which we live is not the exception, but the rule. For a year, we in high-income countries have lived with the rest of the world in a state of emergency that now, with the gifts bestowed by science, at least for some, seems to be lifting. But as our lives return to normal, we are leaving billions of people behind in a state of emergency and deprivation that is sadly all too familiar and enduring. We today again express our solidarity and enumerate steps meant to remedy the inequity that stains the global response. We must forgive our brothers and sisters in poor countries if they remain skeptical until they too feel the state of emergency begin to lift. A century ago, as the world emerged from World War I and the great pandemic said, our present need is not heroics, but healing, not nostrums, but normalcy, not revolution, but restoration. The first would have been to extend early, at-risk public sector financing to support the expansion of manufacturing capacity and the execution of advanced purchase agreements on behalf of a global access facility, of COVAX. The second would have been for countries that invested in vaccine development in the interest of their own populations to have included in their grant and contract agreements global access requirements covering some portion, perhaps 50%, of the output produced after domestic requirements were met. And there are three we must commit to if we are to prevent such crises in the future. We must make collective, coordinated investments to compress medical countermeasure development timelines to 100 days or less. The UK is eligible for the G20 to embrace this goal as well. We must also substantially broaden the number of viral threats covered by vaccines developed on rapid response platforms through coordinated research and development programs. And finally, we must achieve a more equitably distributed and networked global vaccine manufacturing capability for their own health security. Joint commitment to these 5 goals would greatly enhance our collective security. The Rome Declaration is a wonderful statement of intent. Such commitment could be expressed in a binding way in the Pandemic Preparedness Treaty, for which so many of you have expressed support. I and my colleagues in COVAX and the ACT Accelerator stand ready to work with you all for a better future. Thank you.
Thank you, Richard. CPI was a founding member of ACT-A and must take an enormous amount of credit. It promoted vaccine equity, and I welcome your comments in relation to manufacturing, anticipating future pathogens, and the importance of sustained financing for R&D. Let me now turn to our next speaker, Prime Minister Solberg of Norway. Prime Minister, the floor is yours.
Thank you. Health security is a global public good. It's also a social and economic security issue. And health is an essential component of the Sustainable Development Goals. So we must all work together at both the global, regional, and national levels, with governments, UN organizations, and civil society, and with the private sector. CEPI and Gavi are examples of successful public-private partnership. The World Health Organization plays a central coordinating role at the international level. We need to make it possible for the World Health Organization to deliver on its mandate. It must be given operational independence, and it needs to be fully financed. We are prepared to increase our assessed contributions considerably. We need to cooperate across sectors and strengthen coordination of One Health implementation. And we must seize the opportunity to change the course of this pandemic and to be better prepared in the future. We must invest in prevention and in preparedness, in robust health systems and universal health coverage, in research and development, and in diversified manufacturing capacity and technology transfer. When a crisis emerges, the resources must already be available. Financing pandemic preparedness is an investment, and we have been reminded that the investment is small compared to the cost of inaction. Investment in pandemic preparedness is a global public good, which will benefit all countries. We should finance pandemic preparedness collectively based on a system for fair burden sharing. International health regulations and enhance global cooperation in new ways. We believe that a pandemic treaty could establishment of a new global financing mechanism. It will provide predictable funding to different implementers. The world has developed safe and effective vaccines faster than ever before. Now we must ensure universal access. And I'm proud to serve as co-chair of the ACT Accelerator Facilitation Council, together with President Ramaphosa of South Africa. ACT-A is a unique multilateral collaboration designed to increase global access to tests, treatments, and vaccines. And Norway is helping to share the burden. We have contributed $500 million to ACT-A. In addition, we will share surplus vaccines. Our current estimate is 5 million vaccine doses, 1 per capita in Norway. The world also needs to produce more vaccines and to ensure their use. And I'm pleased that Germany and South Africa will co-chair a high-level ACT and G20 working group to this effect. This high-level working group will be able to deliver on the request from the Secretary General GUTERRES for a G20 task force. And I call on all of you to do your part and contribute your fair share to ACT, because no one is safe until everyone is safe. Thank you.
Thank you very much, Erna Solberg. Thank you also for pledging additional vaccine doses in kind. Thank you very much for that. Now we have the pleasure to turn to Prime Minister António Costa of Portugal, also the rotating presidency of the European Union. António, you have the floor.
Thank you, dear Ursula, caro Mario. In this Global Health Summit, we are called upon to prepare the future while still combating the current pandemic. The Portuguese presidency of the European Union Council coincided with some of the worst phases of the pandemic, but also with the vaccination rollout and the start of the recovery. Scientific international cooperation allowed us to develop and produce vaccines in record time. We must now focus on promoting widespread access to vaccines by expanding manufacturing capacities, preventing supply chain bottlenecks, and removing export restrictions. That is why we should not be distracted from our immediate needs. Speed up manufacturing and distribution of vaccines to all, guaranteeing immunization as a global public good. The European Union is doing its part. It leads in supporting research and development of vaccines and in financing their production and distribution. The European Union and its member states are among the lead contributors to COVAX, and the EU is setting up a European vaccine sharing mechanism directed to partner countries. Second, we must deal with the social and economic consequences of the pandemic. We must shore up the recovery on new foundations, making the best use of trends and technologies already in progress before the pandemic, the green transition and the digital transformation. In this endeavor, we must give special attention to those more vulnerable to the crisis and to the ongoing transformations in the economies and labor markets. This week, in the summit on financing African economies, which took place in Paris, we consolidate a consensus on the need of a new issuance of special drawing rights of $650 billion, 33 billion of which will go to African countries. Only with adequate financing countries, especially the most vulnerable countries, will be able to fight the pandemic and foster recovery. Universal access to vaccines should be attained, including via production in Africa. Third, the world needs to be better prepared to prevent future health crises. At the multilateral level, we must support, strengthen, and reform the World Health Organization and promote the full implementation of international health regulations. Portugal is also willing to participate on the negotiation of an international treaty on pandemics within the scope of the WHO and having an international health regulation as its cornerstone. The One Health approach must also be at the center of our discussions. The impact of the effects of climate change in vector-borne diseases should be a top priority, as well as the challenges posed by antimicrobial resistance. The pandemic took us by surprise, but in the past year, we have been learning from our response to it. We learned that it is better to combat the pandemic together than in isolation. That vaccine nationalism, trade barriers, and supply chain bottlenecks will only make us all worse off. That our national health services and their workers are the first and best line of defense against the current and future crises. The Rome Declaration offers us a valuable guidance, and I thank all countries and organizations, as well as the scientific panel and civil society, for their contributions to the debate, helping us to be better prepared for our post-pandemic future. Thank you very much, and thanks especially to Mario to host this major event. Grazie mille.
Grazie.
Prego.
Thank you very much, Antonio. I really welcomed your remarks in relation to expanding vaccine coverage, to the importance of speeding up manufacturing. Let me now turn to the CEO of Gavi, the Vaccine Alliance, Seth Berkley. The floor is yours.
Excellencies and distinguished guests, it's a pleasure joining you here today. I'd like to thank Prime Minister Draghi and President von der Leyen to speak. Almost exactly 1 year ago, before we knew if any vaccines would work, G20 leaders came together in support of the principle of rapid, fair, and equitable access to COVID-19 vaccines through the creation of COVAX, the vaccine pillar of Act A. We knew at that time this would be tough. But this did lead to the unprecedented act of global solidarity from now 193 economies, representing 90% of the world's population, a unique global solution built on the belief that one's ability to pay should not determine whether or not they are protected from COVID-19. Because during a pandemic, Today, under the leadership of Gavi, CEPI, WHO, and UNICEF, COVAX has delivered nearly 70 million doses to people in 125 countries, the first of over 2 billion doses secured for 2021. But as you've heard, there are dramatic and unacceptable inequalities in coverage. We must deliver faster. Of the 2 billion doses, we're on track to deliver 1.3 billion to the people in the 92 lower-income countries later this year that otherwise would have little or no access through the Gavi COVAX Advanced Market Commitment, or AMC. By ensuring frontline health and social workers and vulnerable people are protected in all corners of the world, COVAX can play a pivotal role in stopping the spread of COVID-19. With additional support, we can not only reach more people, but can get there sooner. G20 countries can make this happen. By renewing your support of the COVAX AMC, you can help it bridge a critical funding gap. We already have $6.6 billion pledged, But in April, at the One World Protected Summit hosted by the U.S. government, we launched a campaign to raise an additional $2 billion to pay for additional doses. If we can raise this by the time the world leaders will meet again on the 2nd of June at the AMC Summit, hosted by Prime Minister Suga in Japan, COVAX can increase the total number of secured doses for lower-income countries to at least 1.8 billion doses. To protect close to 30% of the people in AMC countries, potentially preventing up to 800,000 deaths. Furthermore, it'll enable us to slow down the circulation of the virus, which not only reduces the risk of new and potentially more dangerous variants emerging, but will ultimately help us end the acute phase of the pandemic by the beginning of next year. However, in addition to dollars, COVAX also needs doses now. Like many countries, it has been affected by the current vaccine supply constraints, as many of you have mentioned. Because of this, we urgently need G20 countries to share doses, initially at least 20 million of them this quarter, to make up for the shortfall resulting from supply delays triggered by the surge of cases in India. There are now 20 million people in lower-income countries who have received their first dose, but are now at risk of not being fully protected because they may not receive their second dose in time. G20 nations are in a position to prevent this, and in the longer term, increase vaccine coverage, which will be essential to stop transmission by following the lead of countries like France and other members of Team Europe announced today, and the U.S., and donating doses for equitable distribution through COVAX. The U.S. $2 billion funding gap and the more than 20 million acute shortfall needs your urgent support. We have the systems in place. With your help, COVAX can deliver. This will be the largest and fastest vaccine rollout in history. Already, we're preparing for the very large number of doses that will be flowing to countries in the second half of the year, and we also need now to begin to prepare for 2022. We appreciate the global efforts to support COVAX throughout the year, and at this meeting, we look forward to seeing you at the forthcoming June 2nd AMC Summit. Thank you for your attention.
Thank you very much, Seth, for your strong call, rightly so, to donate more to COVAX and to enable COVAX and Gavi to do their important job. Now, I would like to turn to the President of Rwanda, Paul Kagame, mainly for the new partnership with Africa's development. President Kagame, you have the floor.
Excellencies, co-chairs, Mario Draghi, Prime Minister, President Ursula von der Leyen, Excellencies, heads of state and government, distinguished ladies and gentlemen. I am pleased to join you for this Global Health Summit, happening when the COVID pandemic has all of us preoccupied by the health of our people and the well-being of our economies. The challenge also presents an opportunity to do things better and different. First, we have to urgently improve the frameworks and tools needed to defeat this pandemic and others that are sure to follow. Ending COVID-19 will require expanded pathways to vaccine access for populations throughout the world. The COVAX facility, along with African Union Vaccine Acquisition Tax Team and the African CDC, have helped to distribute millions of vaccine doses to our continent. But much more is needed for Africa to defeat the pandemic. In the context of developing hubs for manufacturing the vaccines in our continent, Rwanda is in advanced talks with private firms and multilateral agencies to build manufacturing capacity in our region for the raw materials to produce mRNA vaccines. I thank the European Union institutions for the strong commitment we have seen to working with Rwanda and Africa on this priority. I also thank President Ursula for your efforts to connect us with the right technical partners. On the issue of intellectual property and the discussions around this, I hope soon we could find an appropriate solution to that. Much more important is the technology transfer cooperation on regulatory quality and training of Africa. Within the African Union, we are also working to establish the African Medicines Agency so that there are shared standards among our national regulators. The devastating impact of the COVID pandemic has demonstrated the indispensability of resilient national health systems built around universal healthcare. We appreciate the European Union's leadership on the need for a new pandemic preparedness treaty, which was first proposed by President Charles Michel. We welcome the expected launch of the negotiations process at the upcoming World Health Assembly. Closely related to this, the imperative to increase domestic for the African Union with the African Union Development Agency, NEPAD, providing technical advice. The Rome Declaration to be signed at the summit comprehensively covers the key priorities. Through the African Union Development Agency, NEPAD, we look forward to working with all of you, our partners, including the World Health Organization, Gavi, CEPI, UNICEF, to improve outcomes and save lives on our continent. I thank you for your kind attention.
Thank you, President Kagame. Let me now turn to Prime Minister Hsien Loong of Singapore. Prime Minister, the floor is yours.
Thank you. Your Excellencies, Prime Minister Mario Draghi and President Ursula von der Leyen, thank you for convening this Global Health Summit, and Singapore is very honored to participate in it. COVID-19 has wreaked havoc on economies and people's lives everywhere. The world remains in the thick of the pandemic, but this will neither be the last nor the worst. Sooner or later, something more transmissible or lethal will emerge. And hence, we must take every opportunity to learn from this pandemic, to prepare ahead for the next one. Singapore fully supports the Rome Declaration of Principles to strengthen the global health architecture. The declaration lays out countries' individual commitments to fight COVID-19. A well-functioning public healthcare system is a critical part of any country's pandemic response. So we must strengthen our respective healthcare systems nationally and our capabilities, such as testing, contact tracing, and vaccination. Not just putting plans on paper, but also being able to execute them well. For example, organizing and carrying out vaccinations is a major administrative and organizational challenge, especially in places where populations are large and dispersed and the government's reach is limited. Such preparations should be sustained during peacetime to break the vicious cycle of panic and neglect. Beyond individual efforts, close international and multilateral cooperation is also essential The repeated waves of COVID-19 clearly show that no country is safe in a pandemic until everyone else is safe. Even during difficult times, countries have cooperated to restore supply chains, repatriate citizens stuck overseas, to share tests and medical supplies, and support vaccine multilateralism initiatives like COVAX, so that all countries, especially the least developed ones, would have access to vaccines. Crucially, international scientific cooperation continued. Doctors and scientists shared information, studying the COVID-19 virus, developing treatments and testing vaccines. And this enabled us to improve treatments and produce effective vaccines in record time. Overcoming global pandemics demands a concerted global effort. The WHO has a central role to play to direct and coordinate international health responses, disease surveillance, and preparedness. The Independent Panel for Pandemic Preparedness and Response, the IPPR, has made several recommendations to strengthen the quality and financing of the WHO so that it can continue to operate impartially. Singapore will also do our part to work with all countries to strengthen collective resilience against future pandemics. Singapore is happy to share our experience dealing with COVID-19 and in other areas like urban health emergency preparedness. I look forward to further discussions on taking the Rome Declaration further and to the recommendations of the G20 high-level independent panel in July. Thank you.
Thank you, Prime Minister. Thank you very much. Now let me turn to the Executive Director of the Global Fund, Peter Sands. Peter, you have the floor.
Thank you, President von der Leyen and Prime Minister Draghi and Your Excellencies. For the poorest and most vulnerable in the world, this pandemic has been and is an unfolding catastrophe. So our immediate priority must be to defeat COVID-19 as fast as possible, and not just in the wealthiest countries. The shocking figures for COVID-19 deaths that Tedros and Richard Hatchett cited tell only part of the story. The knock-on impact on HIV, TB, and malaria, on maternal and infant health, and on other conditions is immense and growing. In some of the poorest countries in the world, this knock-on impact will likely exceed the direct death toll. To defeat COVID-19, we must accelerate fair and equitable access to all the essential, but also diagnostics, therapeutics, oxygen, and PPE, so that countries aren't just flying blind, so that they can save the lives of those in, and so that they can protect the frontline health workers who put their lives on the line every day, and without whom none of the tools we're talking about can be deployed. Making this happen means fully funding the ACT Accelerator. If we had fully funded the ACT Accelerator 12 months ago, we would undoubtedly be in a much better position than we are now. If we don't do so now, we will undoubtedly regret it 12 months from now. As a founding member of the ACT Accelerator, the Global Fund is playing a leading role in supporting low and middle-income countries on all the non-vaccine elements of their responses. So testing, treatments, PPE, health and community systems. In doing so, we're leveraging the experience, infrastructure and capabilities used to fight the earlier and as yet undefeated pandemics of HIV, TB and malaria. The Global Fund was created precisely 20 years ago in response to the last big pandemic to strike humanity, HIV/AIDS. And this is a reminder on the positive side that the world can come together to act boldly in response to such. That as a global community, we have at best a mixed record on pandemics. We have left people behind, and we haven't always finished the job. Once people in the wealthiest nations feel safe, political momentum, scientific focus, and financial resources tend to slip away sharply. As a result, we've ended up with residual pandemics, disease, and that's what happened with HIV, AIDS, TB, and malaria. We cannot let this happen again with COVID-19. It's morally untenable, and it's bad epidemiology. With a mutating virus like COVID-19, no one is safe until everyone is safe. Isn't just rhetoric, but epidemiological fact. It's also not practical or cost-effective to draw a false distinction between and all pandemics. Most low and middle income countries' public health responses to COVID-19 were large HIV, TB, and malaria. Most low and middle income countries' preparedness against future threats will be based on what's being done now to fight COVID-19. As we strive to make the world safer from future infectious disease threats, way vulnerable from the deadliest infectious diseases. The earlier pandemics we haven't yet defeated, the pandemic we're facing right now, and future pandemic threats. And let's do so by making health systems stronger and more resilient, more inclusive, more people and community-centered, and more outcome-oriented, and better supported by finance ministry. And greater and more distributed manufacturing capacities. This is how together we can defeat COVID-19 and build an approach to pandemic and equitable, effective, and sustainable. Thank you.
Thank you, Peter. Let me now turn to the President of Switzerland, Guy Parmelin. Guy, the floor is yours.
Thank you, Prime Minister Draghi, Madame la Présidente, Excellencies. First, let me thank our co-chairs for organizing this important summit. About 1 year ago, we came together at the pledging conference on the coronavirus global response. We were at the beginning of an extraordinary global cooperation with the launch of the ACT Accelerator. Since then, with the help of science and innovation, tremendous progress has been achieved. But new variants of the virus remain a great threat, and most of the socio-economic consequences of the virus are still ahead. The pandemic will not be over as long as all countries have not overcome it. Effective and adequate public health measures are required where the pandemic thrives combined with the necessary mitigating socio-economic measures. Strengthened health systems are badly needed, and we must ensure access to safe and effective COVID-19 vaccines, diagnostic and medicines in all countries as soon as possible. Since the beginning of the crisis, Switzerland has been committed to finding global solutions for rapid, affordable, and equitable access to COVID-19 tools. Last year, Switzerland was among the early donors of the ACT Accelerator and other international organizations, especially in the humanitarian sector, to support the fight against the pandemic and its consequences. A few weeks ago, the Swiss Federal Council announced an additional contribution of more than 270 million euros dedicated to the ACT Accelerator. More than a third of this amount will support access to vaccines for lower-income countries through COVAX. In addition, last week, the Federal Council decided to explore the possibilities of providing 3 million doses of vaccines to COVAX. We also must think in the longer term. Globally, we need to scale up manufacturing capacities for vaccines, There are here no easy solutions. We have seen some very good partnerships with the private sector arising from voluntary licensing, enabling larger production while respecting the technological and safety requirements. We need to build on these experiences. On the other hand, we also must ensure that borders remain open to trade of these essential goods. In that regard, let me refer to the Trade and Health Initiative that is currently being discussed at the WTO. I wish to encourage all participants to consider positively this initiative as a way to strengthen our global and coordinated response to the pandemic. Looking forward, there are many lessons to be drawn from this crisis already now. Switzerland had put in place the measures foreseen by the international health regulations. But like others, we have been overwhelmed by the actual pandemic. We all can do better. Strengthening our health systems, promoting a One Health approach, and fully implementing the WHO. In this effort, we should be guided by a strengthened World Health Organization. Many new initiatives have been taken in the last months. It is important now to ensure that well-functioning governance mechanisms are in place to ensure accountability and transparency. We have established several evaluation processes and expert panels at global level. First recommendations will be discussed in the coming days. Building on this knowledge and with our political commitment, we can improve our preparedness and response to future health crises. Finally, I would like to thank all actors involved for their tremendous work in the fight against the pandemic. Switzerland will continue to participate in this international effort in a spirit of solidarity, international collaboration, and multilateralism. Thank you very much.
Thank you very much, President Parmelin. And I have now the pleasure to turn to the Australian Minister of Health, Greg Hunt. Greg, you have the floor.
As Australia's Health Minister, I'm honoured to appear before you today on behalf of our Prime Minister, Scott Morrison, on behalf of the Australian Government and all Australian people. I particularly want to thank President Draghi and President von der Leyen for your leadership on this critical summit. We know that COVID-19 has taken a devastating toll around the world, and I express my deepest condolences to those who've suffered loss and hardship. And I particularly want to thank all of the health workers around the world, especially in Australia, who have tirelessly protected those at risk and those in need. We also know, though, that COVID-19 has delivered powerful lessons and highlighted the gaps and challenges in our global health system. At the same time, it has also created unprecedented multilateral cooperation through mechanisms such as the ACTA. In that context, the Independent Panel for Pandemic Preparedness and Response made many recommendations on strengthening the global health architecture so that it is fit for purpose. Australia recognises a strong, independent and authoritative WHO must be at the centre of any preparedness and response efforts. We urge all G20 member states to play their parts and ensure the WHO is robust, independent and able to fully carry out its operations on the ground. We need improved early warning systems to stop outbreaks at their source. We need stronger action to address antimicrobial resistance and to maintain open and resilient supply chains, especially for our medical goods. And we must always base our response on the best scientific evidence available. And above all else, we need coordinated support to protect those most at risk. The independent report also reinforced the importance of strong domestic action. In this regard, Australia is in a very fortunate position in the battle against COVID-19. Our response has followed a uniquely Australian path, striking balance between our health and economic objectives. We acted early on expert health and scientific advice to close our borders, and we've been able to substantially suppress the epidemic here through containment, capacity building and collaboration, with over 90 days of 0 cases of community transmission this year alone. Australia is also fundamentally committed to supporting others who need assistance, including our neighbours in PNG, Fiji and Timor-Leste, and across the South Pacific. We've committed more than $623 million over 3 years to help countries in the Pacific and Southeast Asia to obtain access to COVID-19 vaccines, and this complements our ongoing support to the COVAX AMC. Ultimately, strengthening health systems is the cornerstone of preventing future health crises. We welcome the powerful symbolism of G20 members and other nations coming to agree on principles and practical action to prevent future health crises. And we look forward to making this happen together, both through the G20 and through the 74th World Health Assembly next week. I thank you.
Thank you, Minister Hunt. Let me now turn to the Minister of Foreign Affairs for Brazil. Minister Franca, the floor is yours.
Thank you very much, President Mario Draghi, and thank you again, President Ursula von der Leyen. Ladies and gentlemen, it's an honor to represent the President of Brazil, Jair Bolsonaro, in the Global Health Summit. President Bolsonaro is since yesterday on a 2-day field trip to the northern region of Brazil, and even though he could not be present due to scheduling reasons, President Bolsonaro assigned me to convey his message in close coordination with the Ministry of Health and to reiterate the importance of health diplomacy for Brazil. I congratulate the Italian G20 presidency and the European Union for the initiative of this high-level meeting. The objectives of overcoming the COVID-19 pandemic and building an international system that is more resilient to future pandemics require greater international cooperation and the strengthening of national health systems. The equitable access to vaccines, tests, and treatments, which we, G20 members, made a commitment to ensure to everyone, leaving no one behind. Unfortunately, it's not yet a reality. While some wealthier countries have plenty of vaccines and other resources to protect their populations, less developed countries are suffering the consequences of overwhelming pressure on healthcare and the lack of access to existing vaccines, supplies, tests, and treatments. In order to accelerate the vaccination process and the fight against coronavirus worldwide, Brazil defends the adoption of concrete measures to strengthen the international production of vaccines, medicines, and equipment in a greater number of developing countries, as well as the facilitation of health agreements, licensing, and transfer of technology. International cooperation and the participation of pharmaceutical companies will be essential to accomplish these goals. Brazil is negotiating technology transfer contracts with major pharmaceutical companies to manufacture vaccines in our public laboratories. While we recognize the flexibilities of the WTO TRIPS agreement, we are ready to enter into new partnerships with companies interested in producing in Brazil, benefiting from our health industrial facilities, skilled workforce, and experience in the development, production, and distribution of vaccines. We are also investing in expanding our production capacity with the construction of the Santa Cruz complex in Rio de Janeiro, which will be the largest biopharmaceutical center in Latin America. We are as well planning the future installation in Brazil of a laboratory with the highest level of biosafety available, NB4. Ladies and gentlemen, universal health coverage and a balanced approach to the relationship between human health, animal health, and the environment will be paramount to overcoming the pandemic. In Brazil, our Constitution guarantees universal access to health care. Our unified health system, or SUS, as we call it here in Brazil, is one of the largest free and universal public health systems in the world. Right now, Brazil still needs assistance. I would like to thank you publicly, once more, for the support we have received from friendly countries, especially donations of medicines for critical care patients. As far as vaccines are concerned, so far we have distributed almost 90 million doses and administered over 55 million doses of vaccines. With more vaccines in hand, we could considerably speed up this process to vaccinate up to 2.4 million people a day. Brazil commends the efforts carried out by the World Health Organization during the pandemic, not only to speed up development and scale up production of COVID-19 vaccines, therapeutics, and diagnostics, but also to make them accessible to everyone through mechanisms such as ACTA and COVAX. Through the COVAX facility, the government of President Jair Bolsonaro contracted 42.5 million vaccine doses for the Brazilian population. We are now studying the possibility of contributing to the other pillars of ACT Accelerator, as we understand the suffering caused by pandemic will only be alleviated when all countries have adequate tools to fight it. The government of President Jair Bolsonaro is proud of Brazilian legacy of international cooperation. Brazil intends to help other countries in their fight against COVID-19 as soon as possible, initially in South America, but also in Africa and other regions, through the donation of vaccines, diagnostics, tests, and treatments. By means of our health diplomacy, we are committed to doing our part to overcome the pandemic, not only in Brazil, but also around the world. Thank you very much.
Thank you very much, Minister. And now I have the pleasure to introduce the Minister of Health of Brunei for the Association for Southeast Asian Nations. Minister, you have the floor.
Co-chairs, distinguished delegates, ladies and gentlemen. The COVID-19 global pandemic has negatively affected the lives and well-being of people across the globe, including in the member states of ASEAN. On behalf of the government of Brunei Darussalam, I would like to express our absolute solidarity with individuals affected by the disease and affirm our commitment to work together towards effective response to the pandemic and post-COVID recovery. In responding to the pandemic, ASEAN has implemented various actions across its sectoral bodies within the health sector. This includes working towards the establishment of the ASEAN Center for Emergency Diseases. Reports on risk assessment for international dissemination of COVID-19 in the ASEAN region, exchanges on laboratory readiness and response, and risk communication in addressing false information. In addition to work within the health sector, the ASEAN response cut across disciplines through the ASEAN Comprehensive Recovery Framework, which articulates a collective ASEAN response through the different stages of recovery by focusing on key sectors and segments of society that are most affected by the pandemic, setting broad strategies and identifying measures for recovery in line with sectoral and regional priorities. We are pleased to share that ASEAN's team under Brunei Darussalam's chairmanship this year, We Care, We Prepare, We Prosper, aims to strengthen efforts towards recovery, resilience, and shared prosperity, and is very much relevant to the current situation. Brunei Darussalam is also pleased to report that our deliverables on health in ASEAN will focus on COVID-19 implications on mental health, as well as mental health among adolescents and young children. Even as we focus on the immediate challenges of COVID-19, we must not lose sight of our goal to leave no one behind. Measures taken to protect public health must ensure that all people, especially those at risk or infected by COVID-19, including women, children, the elderly, and the vulnerable group, can access essential healthcare services. Similarly, we emphasize the importance of ensuring affordable and equitable access to COVID-19 vaccines, which has been greatly hampered by the pandemic. Border restrictions and export bans have affected movements of commodities, including vaccines and other pharmaceutical and medical consumables. The global community must intensify the efforts to ensure equity in vaccine distribution by delivering vaccines, sharing vaccine technologies, and supporting the global scale of vaccine manufacturing efforts, particularly to those countries most in need, if we are to prevent unnecessary death and the emergence of new variants. To conclude, we affirm our commitment to work together to explore innovative solutions for COVID-19 response and recovery. Working synergistically, we can magnify our impact by using our relevance, scientific authority, expertise, and networks to engage with communities to set and implement a health agenda that improves the lives of all our people. Thank you.
Thank you, Minister. Now, let me turn now to the Minister of Health of Saudi Arabia and previous G20 President, Minister Al-Rabi'a. The floor is yours. Minister Al-Rabi'a, we don't hear you. Can you hear me? Minister Al-Rabi'a, can you hear me? The floor is yours. Minister Al-Rabi'a, do you want to activate the microphone WebEx? Then I suggest we move on and then we'll ask Minister Al-Rabi'a later. So you, okay, thanks Ursula. Before our closing remarks of the GHS, Ursula and I discussed the possibility to recognize the key role that Act A has played and will continue playing in this current pandemic. For this reason, we have developed together with the Act A leadership a dedicated session within the Global Health Summit to celebrate it. President Ramaphosa of South Africa will open the session as co-chair of Act A. He will then be followed by a video focused on the key role of Act A. President Ramaphosa, please, the floor is yours.
Well, thank you very much, Prime Minister Draghi. And once again, I extend my greetings to all of you, Your Excellencies, and would like to thank you. Welcome to the ACT Accelerator segment of this Global Health Summit. It is indeed my privilege to be the co-chair of the Facilitation Council of the Access to COVID-19 Tools Accelerator, together with Prime Minister Solberg of Norway. While we have made quite good progress as the international community in battling this pandemic that engulfs the whole world. There are still substantial hurdles, including shortages of vaccines, oxygen supplies, and other life-saving interventions. The unequal distribution of vaccines, test kits, treatments, as well as personal protective equipment is widening the gulf between high and low income countries. Since its establishment just over a year ago, the ACT Accelerator has facilitated access to diagnostics and therapeutics for COVID-19 for low and medium middle income countries. It is the most viable global mechanism that we have that can ensure equity of access. To maintain this good work, we need to step up our collective commitment through support to ACT A and financial support for that matter, for the ACT Accelerator to implement its priorities for this year. We need to urgently mobilize approximately $18.5 billion US. It is in our common interest that all countries are able to vaccinate their populations as quickly as possible, and that special support is given to low and middle income countries. In this regard, we appeal to all countries to support the proposal made to the World Trade Organization for a temporary waiver of the agreement on trade-related aspects of intellectual property rights. As I said earlier, this will facilitate increased production of vaccines in emerging economies. I'd like to believe that this is the time to deepen our collaboration to ensure equitable access to medicines. This matter does not need to be overstressed. It is there for everyone to see. And I'd like to say, what we need is the will amongst all of us so that we can move forward in the spirit of solidarity and partnership, which we have demonstrated more than we've ever done in the history of the world. This is now the time to do it when we come to vaccines. I'd like to thank you for your participation also in this segment. Thank you very much.
Thank you. Thank you.
Accelerator was launched. $14.6 billion have been raised, thanks to the unprecedented mobilization of financing from around the globe. But we must do more. The ACT Accelerator needs $18.5 billion in 2021 to prevent further devastation in our most vulnerable countries. Using a formula that factors in national income, benefits from the resumption of trade, and income per capita, each country has been set a target contribution to ensure equitable investment alongside equitable distribution. Funding the ACT Accelerator fairly is not an act of charity. It's a global insurance policy to protect us all. The longer poorer countries go unprotected, the more the disease will spread, mutate, and threaten all countries. It's time for all high and upper middle income countries to step up by contributing their fair share. A small part of domestic stimulus packages should cover investment in the ACT Accelerator as a matter of national interest, and the 30 largest contributors can lead the way, covering almost 90% of the cost. We cannot afford not to act. This is no time for apathy or complacency. Inaction has led to millions of lives being lost already, and we have the power and the responsibility to act for the sake of our economies, ourselves, and our future. Act together. Act now to end the pandemic.
A very clear message. I'm happy now to introduce Erna Solberg, the other chair of the ACT Accelerator. Her intervention will be followed by a video by Rosalyn Morauta, vice chair of the board of the Global Fund, and by José Manuel Barroso, the chairman of Gavi. Erna, you have the floor.
Thank you. And as you have all seen now, there is an urgent need to increase global access to tests, to treatment and vaccines. ACT-A can only deliver on its mandate if it has sufficient resources. President Ramaphosa and I have been working hard to mobilize financial support. We need full financing of ACT-A to beat the pandemic. There is a funding gap of $18.5 billion. This amount may seem high, but it's small compared to the cost of inaction. We have spent much more on economic stimulus packages. Countries need to tap into their fiscal stimulus funding to contribute to ACT-A. There's a social investment in this, and there's a macroeconomic investment. We have developed a financial framework for how we can share the costs. A fair burden sharing system will benefit all countries. So I call on all of you to do your part and contribute your fair share to ACT-A. And I thank all of you who have already provided support. Norway is helping to share the burden. $500 million to ACT-A is a sound investment for us. In addition, we will share surplus vaccines through COVAX when possible as part of Team Europe efforts. Our current estimate is 5 million vaccine doses. Fast and fair global access is crucial, and we must all contribute funding. And we must also share vaccines, tests, and treatments. It is the right thing to do now, and it's also the smart thing to do. So let's end this crisis together now. Thank you.
I'm ready.
At the time of this critical summit, COVID-19 is on the rise globally. Many countries are experiencing emergency situations due to new waves of infections. Mutations of the virus and the alarming infection rates in many regions of the world underscore the urgent need to contain COVID-19 everywhere. The ACT Accelerator was created to provide a rapid and comprehensive response to COVID-19. To defeat the virus, we need a holistic global approach that brings together testing, treatments, vaccines, and the health systems to deliver them. Vaccines alone will not be enough. Until vaccines are made available worldwide, and as variants of the virus continue to emerge, the best strategy to fight COVID-19 is to test, trace, treat, and isolate. This requires hundreds of millions of tests, urgent oxygen support, effective new treatments, and training in PPE for healthcare and lab workers. If testing is not available in low-income countries, we're creating the perfect conditions for ever more virulent and deadly strains of COVID-19 to emerge. Since new variants can undermine the efficacy of vaccines and treatments and will inevitably spread across the world, this puts at risk even those countries that have made the most progress in vaccinating their populations. The current waves of COVID-19 hitting several countries are showing how vital life-saving treatments like oxygen are. According to the COVID-19 Oxygen Needs Tracker, over $6 billion is needed to address the daily oxygen needs in low and middle income countries. Last but not least, COVID-19 is dramatically impacting health systems and community health networks. Around 14% of COVID-19 cases reported to WHO are among health workers. Protecting frontline health workers, especially in regions badly affected by the scarcity of human resources for health, is crucial. In responding to COVID-19, we need to reach everyone, especially the most vulnerable. We can beat COVID-19 only if we act together and if all available tools are deployed and made available to all based on need. At the moment, the ACTA pillars related to diagnostics, therapeutics, and health systems are extremely underfunded. Urgent and substantive additional contributions are needed to be able to fight COVID-19 effectively by using all the tools we have at our disposal. Failure to do so will produce many more avoidable deaths and will prolong the global health and economic crisis.
As a global community, we need to understand that this pandemic is not over anywhere until it's over everywhere. Through COVAX, we have already reached 122 countries with our vaccines, but we are still very far from the around 2 billion doses that we'd like to have distributed around the end of the year. And also beyond vaccines, we need an integrated and equitable approach to support for all the tools to fight this coronavirus. Without increased funding, the virus will keep circulating, mutating, possibly originating new variants that can become more dangerous. This means more lives will be lost, more economies will be at risk. And one thing is certain, the economic cost of this pandemic is much higher than the cost of all the vaccines, diagnostics, and therapeutics. Not only the cost in human lives is unbearable, but also the global economic cost will be much higher than the necessary funding for Act A. This is a matter of justice, but it's also a matter of economic rationality. It is in this spirit that we appeal for an increase in funding for all the tools of the Act A pillars: vaccines, therapeutics, diagnostics, and health systems. In the same spirit, I am grateful that the Prime Minister of Japan will co-host with us the AMC COVAX Summit on the 2nd of June. This will be a moment for world leaders to join forces and to give a boost to COVAX, our global COVID-19 vaccine response. I count on your support. Ladies and gentlemen, in every crisis there is a defining moment. I believe that moment is now. I thank you.
Thank you. Thank you, Emmanuel. Before we give the floor to Dr. Tedros, may I ask Minister Al-Rabia if he has solved his technical problems? Please.
Yes, you hear me?
Yes, I can. Okay.
Excellent. Okay, thank you. Your Excellencies, ladies and gentlemen, on behalf of His Royal Highness Crown Prince of the Kingdom of Saudi Arabia, Prince Mohammed bin Salman Al Saud, it gives me great pleasure to extend our gratitude to the Prime Minister of Italy, Mr. Mario Draghi, and the President of the European Commission, Mrs. Ursula von der Leyen, for organizing this Global Health Summit. Health is a priority, and this pandemic has highlighted its importance and its effects on all sectors and at all levels globally. As we undergo these circumstances, collectively, we are reminded daily of the precious lives lost due to COVID-19 and the exceptional individuals who fight this pandemic selflessly. Health for all has been the guiding principle behind the Kingdom of Saudi Arabia's Strategic Vision 2030 framework for health. The transformation of our health sector has been integral in the Kingdom's response to the health, economic, and social consequences of this pandemic. This, in addition to the leadership's unwavering support at the highest levels, has given us a great advantage and a handle on this pandemic. We are aware that the world still faces challenges and possibly one of the greatest health catastrophes ever experienced by humanity. We believe that through joint international cooperation and the mobilization of global health efforts, we will, God willing, be able to overcome this pandemic, as no one is safe unless all are safe from this pandemic. During the Kingdom of Saudi Arabia's G20 presidency, the custodian of the two holy mosques, King Salman ibn Abdul Aziz, called for a virtual extraordinary summit of the G20 leaders and heads of states and international organizations to coordinate global efforts to combat the pandemic and to mitigate its humanitarian, social, and economic consequences. The Kingdom maintains close and active cooperation with the World Health Organization, the European Commission, and all relevant parties involved in addressing the COVID-19 pandemic. Saudi Arabia participated in all stages of the establishment and launch of the initiative to accelerate equitable access to tools in order to combat the pandemic through the ACT Accelerator, including the COVAX facility. The Kingdom has supported the ACT Accelerator and international organizations with the amount of $500 million and has provided further assistance amounting to $750 million at the regional and international levels to address this pandemic. We also urge all countries of the world to support the ACT Accelerator, as it is the best way to combat the pandemic, and it is the main platform to support the least developed countries. And in conclusion, Saudi Arabia endorses all efforts put forth in the valuable Rome Declaration, the declaration with its principles promoting global solidarity, justice, multilateral cooperation, reliance on evidence-based policies and science, and a focus on sustainable development. Thank you.
Thank you. Okay, I just want to thank President Ramaphosa for his video, and thank you very much for recalling the importance of ACTA. I would also like to thank Gordon Brown, who's featuring in this video. Now, I will give the floor to Dr. Tedros for the closing remarks.
Grazie mille again, Prime Minister. Excellencies, dear colleagues and friends, first of all, I would like to thank President Ramaphosa and Prime Minister Solberg for their leadership of the ACT Accelerator Facilitation Council. And I would like to thank all of our partners in the ACT Accelerator for their collaboration over the past year. When the pandemic erupted more than a year ago, we faced a fundamental challenge. We knew that vaccines, rapid diagnostics, and therapeutics were on the way, but we knew from experience that market forces alone would leave the world's poorest and most vulnerable people behind. Today, we can prevent COVID-19 anywhere with new vaccines. We can detect it anywhere with new rapid tests. We can save lives everywhere with oxygen and dexamethasone. And we have a unique mechanism for making these life-saving tools available everywhere, the ACT Accelerator. We have demonstrated that the ACT Accelerator works. We have shipped 70 million vaccines to 125 countries and economies, as well as hundreds of millions of tests and supplies of oxygen and dexamethasone. But as we all know, vaccine nationalism, vaccine diplomacy, and severe supply constraints have left us with a yawning chasm between the world's vaccine haves and have-nots. It's not just vaccines. Low-income countries are testing at rates up to 100 times lower than in high-income countries. Many low and middle-income countries are also experiencing devastating shortages of oxygen and other essential therapeutics. The ACT Accelerator and COVAX were created to address these market failures. We now have an opportunity to fix the global imbalance. First, we need to close the $18.5 billion funding gap for the ACT Accelerator. Second, we need countries to donate vaccines immediately through COVAX, which is the agreed global mechanism for distributing vaccines. We welcome the generous announcements made today. Thank you so much. And in the coming weeks and months, we will need hundreds of millions more doses. And we need companies to help make donations happen fast by giving COVAX the first right of refusal on all uncommitted doses by 2021. Third, we must urgently and dramatically scale up production of all of these tools through voluntary licensing, sharing technology and know-how, and waiving intellectual property rights. Excellencies, we are at a critical juncture. The ACT Accelerator is a historic forward-thinking initiative based on the principles of solidarity and equity. But we have not yet achieved what we set out to achieve. We must harness the same urgency with which vaccines, tests, and treatments were developed to distribute them as far and as fast as possible. Let's finish the job we started. And finally, I would like to thank President Ursula von der Leyen for her leadership on ACT Accelerator from the start and now. I thank you. Thank you so much. Grazie mille, Prime Minister.
Grazie. Thank you. Thank you to all of you. Let me say just a few words before I give the floor to Ursula. Dear colleagues, ladies and gentlemen, dear Ursula, I'm very pleased with the results that we have achieved today. This summit has been a timely reminder of the power of multilateral cooperation. And the reason why I'm saying this is that we have an important declaration upon which I'll say a few words later, but this declaration made of principles, commitments, promises, is also accompanied by some real, concrete action immediately. And so I just want to thank the countries that pledged so much in vaccines and in financing. I want to thank the private companies that also pledged a significant, I would say staggering amount of vaccines, and the multilateral institutions for all these pledges that certainly is going to change the landscape immediately. I should thank especially Ursula, because she's been the main driving force behind the pledges. So when we come to the declaration, one would say that this will serve as a solid base to strengthen our response to the emergency, this emergency, and the future crisis. And this, what is it? It's a set of principles that will ensure that we are better prepared for a future pandemic. First, we must strengthen the role of multilateral institutions. We must provide the WHO with sustainable and predictable funding and allow it to become more effective. As we have learned during this crisis, strong international guidance is crucial to ensure that there is an effective early warning system in place and that governments can share quickly their best practices in preventing, containing, and managing a pandemic. However, I just want to make a point here. I think it's been briefly touched during our discussion. Health policy is only one of the challenges facing rich and emerging countries today. We must also address significant economic risks. International financial institutions must provide the necessary support to low-income countries to ensure that this health crisis doesn't turn into a wave of sovereign debt crisis. In particular, we must now put the International Monetary Fund in the position to provide an effective shield for the world's poorest countries. The Rome Declaration rightly emphasizes the importance of pursuing a One Health approach. And here I'm coming to climate, to preserve human, animal and environmental safety. This is the key priority of Italy's G20 presidency. The scientific expert panel has stated how most infectious diseases are caused by pathogens that are derived from animals. Their emergence is largely driven by deforestation, wildlife exploitation, and other human activities. Effective environmental action can help to defend animal welfare and ultimately mitigate the risk of new health threats. When pursuing a common strategy to prevent future pandemics, we must uphold our commitment to limit environmental damage and tackle the climate crisis. The Sustainable Development Goals offer a useful set of targets to achieve this overarching objective, starting with the COP26 conference that, as I think I said before, we are co-chairing with the United Kingdom. International cooperation should not be limited to the official sector. Global trade is just as important, and much has been said about this. The pandemic has shown us how collaboration between companies is paramount to foster innovation, boost production of essential medical goods. The COVID-19 vaccines are the product of complex supply chains spanning across many countries, each one building upon its own industrial capacity and expertise. The Rome Declaration rightly defends the role of the multilateral trading system, and in particular the central role of the World Trade Organization. We must keep trade flowing across borders and eliminate unjustified commercial barriers and blanket export bans. This is essential if we are to react effectively to shocks. Finally, the Declaration stresses the role of knowledge for overcoming the current and future health crisis. Scientific ingenuity has opened the path to exit this pandemic. The first vaccine was submitted for approval 9 months after the WHO declaration of the international emergency, and that's been a truly historical achievement. We must continue to invest in our scientists and provide incentives to private companies to do the same. Moreover, we must ensure that information is shared rapidly and openly while preserving adequate protection to intellectual property. International scientific cooperation has been one of the reasons behind the rapid development of existing COVID-19 vaccines. We need better data sharing and know-how transfers to allow the widespread and equitable distribution of the fruits of innovation. So let me thank you again for a very successful summit. The world is in a much safer place thanks to your valuable contributions. Thank you. Ursula.
Thank you very much, Mario. Dear friends, this morning I said that we have two great tasks to achieve: to get this pandemic under control and to build a better global health framework to prevent and prepare for future health threats. On the first goal, the leaders made some important commitments. They made substantial financial commitments. They made in-kind commitments. Team Europe pledged to donate 100 million doses of vaccine till the end of the year. And the European industrial partners, BioNTech, Pfizer, Johnson & Johnson and Moderna, committed to deliver 1.3 billion doses this year for non-profit to low-income countries and at lower costs for middle-income countries. We are really grateful for that. And on the second goal, I believe that this summit will go down in history as a milestone in the fight against pandemics. Our multilateral cooperation is the golden thread running through the declaration. We have agreed to work together to prevent harmful bottlenecks in supplies. We have agreed to use all of the flexibilities provided by the intellectual property system. We've agreed to promote equity and access to vaccines, diagnostics, and other medical supplies. We agree on the importance of closing the Act A funding gap and learning from its experience for future efforts. We agree to work together to identify outbreaks more rapidly and with better surveillance. And we must support our people, our healthcare professionals and our researchers. And we must provide them with the resources they need to protect us. We must give our continued attention to One Health, big topic today, to strengthen evidence-based institutions and to build dialogue and trust with our communities. So, I am delighted to declare our joint endorsement of the Rome Declaration. But let me also remind you that this is only a beginning. Good intentions are not enough. They are important, but not enough. They must be followed by a concrete action. So in a few days from now, the World Health Assembly will take place. Let us take our principles there and share them with the whole world. I would then like to ask the upcoming G7 Summit to put health preparedness on their agenda. We heard today the chair, the presidency, so this is very probable. And I'm pleased that we are holding ourselves to account by discussing when we meet again in Rome in October, dear Mario. So thank you very much for hosting this summit, and we are very much looking forward to come with a full agenda in fall to Rome again. Thank you.
Thank you, Ursula. Thanks to all of you. Thank you.